प्रॉब्लम क्या है, ये तो दिक्कत नहीं, पार्ट 1 पार्ट में जाएगी। हेलो, कनेक्ट हो चुका है क्या? वही 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 लिंक है, दूसरा लिंक है? ओके, ठीक है, ठीक है। अभी कुछ नहीं करना है ना, बस सीन 2 सेलेक्ट करना। सब ऑन ही है, एंड नहीं किया अभी। हाँ यार, ये टेक्निकल आप देखते रहना यार, नहीं तो मुझे नहीं समझ में नहीं आ रहा है। अच्छा, अभी क्या करना बताओ मुझे। ओके, Okay. Now let's start with the NEET PG 2020 questions. Yeah. So I'm audible and visible. I'm audible and visible. Everybody? Yes, say yes. Now let's start with the 2020 questions. Am I audible and visible, everybody? Yeah. Yes, fine. Now we are into the NEET PG 2020 questions. Okay. So this is the question asked in 2020. A deceased male was brought to the mortuary for post-mortem examination. His relatives reported that he had a tattoo over the skin. He had a tattoo over the skin. Yeah. Which was not found on examination. Which of the following structures would you examine? So this is the question asked in the exam. So answer for this question is lymph node. So whenever tattoo which is not visible, you can dissect the lymph node and you can look for the tattoo in the lymph node. Like example, axillary lymph node and other lymph nodes. Remember, tattoo also we can use infrared photography. Infrared photography, you can use magnifying lens. So all this also can be used in the examination of faint lymph nodes. Let me discuss about this. So this is a lymph node. This is the lymph node during post-mortem examination. You can see the tattoo material here. You can see the tattoo material. Tattoo material here. There are some questions can be asked about the tattoo. So what are the common dyes used in tattoo? The common dyes used in the tattoo, it's actually again an information based question, a fact based question. Indigo, cobalt, carbon, India ink, all this can be used in the tattoo preparation. If faint tattoo is there, you can use infrared photography, UV lamp, magnifying lens and high contrast photography. Remember, the tattoo has a very important medico-legal importance. With the help of tattoo, you can identify the religion of the person. It will give you some idea about the personality. So, like example, Om mark is there, then it is of Hindu religion, like that. Now, for interest sake, I'm asking you. So, this is the tattoo. Anyone, can you tell me what is this tattoo suggestive of? Here you can see the tattoo by using India ink preparation. There is a blue bird design. There is a blue bird design, and what is this? What is this known as? Blue bird design. So this shows that, anyone can you guess? Anyone can you guess about the tattoo? Anyone about this? Can you guess? Blue bird design, that shows that homosexuality. Yes. Next question. Which section of the IPC deals with punishment of perjury? We discussed already about this question. Which section of the IPC deals with the punishment? What is the answer for this question? All of you try this. Try this. Try this. Try this try this, all of you. Which section of IPC deals with the punishment of perjury? So all of you try this. So this must be 193 IPC. 193 IPC. The correct answer is 193. The most common drug which causes physical dependence. Physical dependence. So here the question about the dependence. Remember, dependence can be two types. Physical dependence or psychological dependence. So the option is ketamine, heroin, LSD and phencyclidine. Yes. So here the best answer for this question is heroin. Okay. The most common drug among these. So ketamine is known as dissociative anesthesia. So that is not the answer. LSD, it can cause dependence, but the withdrawal syndrome and all very minimal. Yes. Phencyclidine is also known as angel dust. That is also not the answer. Your answer should be heroin. So heroin is a morphine. So heroin is a morphine. So which causes very high dependence. It causes very high dependence. Very high dependence. The dependence can be physical dependence or it can be psychological dependence. So it can be physical dependence or it can be psychological dependence. Psychological dependence. Yes. Now let me discuss about this heroin, because this is very commonly asked in the exam. Heroin. So all of you, this is the spring points about the heroin. What is heroin? Diacetyl morphine. What is the mechanism of action of heroin? It acts on dopamine mesolimbic reward pathway. You can see the heroin that is prepared from the morphine, and the plant is known as Papaver somniferum. So this can be asked in exam. Papaver somniferum. Papaver somniferum. So this can be asked as a image based question. So all of you remember, this is Papaver somniferum plant, nothing but the plant of the opium. And we can see the heroin here and also the morphine. It's actually morphine. So it also heroin is brown sugar. It is brown in color. So heroin, remember there are different routes of heroin. So one is IV injection, skin popping. I know there are many methods are there for heroin. So what are the MCQ point? Heroin is also known as smack, brown sugar, junk rope. Speedball is the question asked in the exam. What is speedball? So let's print all of you. All these are MCQ point, very commonly asked in the exam. Speedball means heroin plus cocaine. So the combination of heroin and cocaine that leads to very high effects. The cocaine is a deliriant. Heroin is a CNS depressant. So what is speedball is the question asked. Your answer should be that is heroin plus cocaine. Then one more question asked in the exam. Hot shot. What is hot shot? The hot shot means heroin plus strychnine. Heroin plus strychnine is known as. Sometimes what happens? So heroin which is mixed with the strychnine as an adulterant which causes sudden death. So that is actually due to hot shot. The strychnine is a spinal poison which acts on the spinal cord, causes muscle spasm, and heroin is an opium. It causes respiratory depression, meiosis, and also euphoria. NDPS Act, that is also can be asked in the exam. NDPS Act. NDPS Act means Narcotic Drugs Psychotropic Substances Act 1985. So this can be asked in the exam. Heroin consumption, heroin cultivation, heroin transport is a punishable offense under NDPS Act. NDPS means Narcotic Drugs and Psychotropic Substances Act. So yes, this can be asked. What are the clinical features? So clinical features, as we discussed already, it causes meiosis, it causes respiratory depression, and also it causes it also causes euphoria. Treatment, acute poison. Whenever there is acute poison, we can use naloxone or naltrexone. Okay. So the question asked in the exam, what is the drug that is used in chronic addiction of heroin? Anyone, can you guess, all of you? What is the drug that is used in chronic addiction of heroin? Anyone, can you guess? Anyone? Yes, come on. What is the drug that is used in chronic addiction of heroin? Anyone, can you guess? Guess, all of you. Guess. Yes, come on, my dear students. Come on, guess. Yes. So chronic addiction, we use methadone or suboxone. So methadone is the correct answer. Methadone or suboxone, that is used actually. So that's about this heroin. Okay. Next question. A 5-year-old child with a history of perianal pain. So perianal pain brought to OPD. On subjecting specimen from the perianal region to a test, it produces yellow needle crystals of spermine picrate. So there are some yellow needle crystals are there. The crystals of spermine picrate. What is the test done here? So whenever in the exam yellow needle shaped crystals are given. So whenever the question yellow needle shaped crystals, can you guess? Neelam, Dr. Tarakanta, Neelam Bhatia, MBBS Synapse, Tropical Capricorn, Joseph. Can you guess, all of you? Guess. Yellow needle shaped crystals are there. So whenever yellow needle shaped crystals, your answer should be Barberio test. In Barberio test, there is a formation of spermine picrate. Crystals. So this spermine picrate crystals, they are of yellow, they are of needle shaped crystals. So that is Barberio test. So Barberio test is one of the presumptive test for seminal stain. What is Florence test? The Florence test is also test for the seminal stain. There is a formation of dark brown rhombic crystals. You will see dark brown rhombic crystals. Takayama test and Teichmann test, they are used for blood stains. Okay, and remember, Takayama test and Teichmann test, they are Hemin crystal test. They are used for confirmation of the blood stain. In case of Takayama test, you will see pink feathery crystals. In Teichmann test, you will see brown rhombic crystals. So that can be asked in your exam. Okay, so Takayama, so that is pink feathery crystals. Teichmann test, brown rhombic crystals. Both are the test for the blood stain. They are Hemin crystal test. They are confirmatory test for blood stain. Yes, okay. Come on. Next, now we'll discuss about seminal stain. So seminal stain. What are the tests for seminal stain? So all of you, this is the ultra important topic. So this is a very important topic. So this is ultra important topic, blood seminal stain. Okay, what are the tests for the seminal stain? So I'll just go a little fast. Seminal stain, mnemonic is A, B, C, D, E, F, G. So that the mnemonic is A, B, C, D, E, F, G. What are the tests for seminal stain? A for acid phosphatase test. So A for acid phosphatase. Acid phosphatase is an enzyme that present in seminal fluid. That is one of the commonest biochemical tests used for identification of seminal stain. So all of you write in the chat box, acid phosphatase is the most common test. So all of you write in the chat box, acid phosphatase is the most common test for the seminal stain. Then one more A, ammonium molybdenate test. This ammonium molybdenate test that detects phosphorus. And it gives rise to the yellow color. So we discussed in our classes, ammonium molybdenate test that gives rise to yellow color, phosphorus. Very good, very good. Next, B for, I think you guessed it, Barberio test. We discussed already. Barberio test, spermine picrate crystals, they are yellow needle shaped. So they look like this, yellow needle shaped. C for creatinine phosphokinase test. This is very interesting test. Creatinine phosphokinase, it is used for the stain, the old stain. Say example, the rape has happened some 10 years back, 5 years back, old stain, you can use the creatinine phosphokinase test. And there is one more C in the seminal stain, Christmas tree staining. So remember, this is one of the confirmatory tests. So all of you remember when the question asked commonest test, acid phosphatase. Confirmatory test for seminal stain, your answer should be visualization of spermatozoa by using Christmas tree staining. That is a confirmatory test. D for lactate dehydrogenase test, which is one of the specific biochemical test. So lactate dehydrogenase that present in the seminal stain, that is one of the specific tests for the seminal stain. One more D here, D for dry semen. So when you examine the dry semen under the UV light, you will see the bluish white color. So that is because of the protein that present in the seminal stain. That is for D. E for ELISA test. F for Florence test. Lastly, that is the G for, remember G, anyone can you guess? What is G in seminal stain? What is G here? We discussed all this. What is G now? What is G? G, can you guess? Yes, come on, G, you can you guess here? G. Yes, come on. Yes. Come on, beta. Beta seminal stain. Yes, MBBS, Neelam, Bhatia. Yes, Tarakanta, Capricorn. G. What is G? G for glycoprotein P30 test. So it is also one of the common test. It is also based on the seminal stain, that is acid phosphatase. So this is about the seminal stain. All of you please concentrate. This is a very, very important topic. Blood stain and seminal stain. They are asking repeatedly. Almost alternative year they are asking about the seminal stain and the blood stain. So please remember, this all are very commonly asked in the exam. And remember, whenever there is a azoospermia, whenever there is a vasectomy, you can use acid phosphatase test. So what is the test used in vasectomy? Acid phosphatase test. Yes. Now we are going to discuss the next question. In the case of rape of a young child, the hymen is usually. Can you guess here? Anyone, all of you guess? Hymen rupture in children, it is very, very rare. Why? So yes, it is deeply situated. The correct answer for this question is C is the correct answer. Yes, good. Rose Joseph, Leenam Bhatia. Yes, answer for this question is, that is C is the correct answer. So unruptured, since it is situated deeply. Okay, that is the correct answer. So now one more topic very commonly asked is the types of hymen. Let me discuss about types of hymen. There are different types of hymen. The one is the annular hymen. Okay, annular hymen. So which has a central opening. Central opening. Second one, crescentric hymen. It is the most common hymen. If they ask you an exam, last year NEET PG 2022, the question was about septate hymen. Hope you remember there was a question about septate hymen. Remember crescentric hymen, so it is like a moon shaped, hanging anteriorly or posteriorly, the hymen fold of mucous membrane. Septate hymen, you will see the two openings. You will see the two openings. Cribriform hymen, you will see the multiple openings. You can see here multiple openings. Fimbriated hymen, you will see the notches. So this can be asked in the exam. So fimbriated hymen has a notches. The question asked in the exam, the hymen resemble like artificial tail or hymen mistaken for the tail. What is the answer for this question? Anyone, can you guess? The type of hymen confused or mistaken as a tail, that is known as artificial tail. What is the answer for that question? Anyone, can you guess? Yes, anyone can you guess? Anyone can you guess the answer for this question? Yes, come on. Fimbriated. Yes, your answer should be fimbriated hymen. Fimbriated hymen is the correct answer. Good. So, and one more point, remember, the most common site of hymen tear is posterolateral. So in case of rape due to penetration, so penetration of the penis, the most common site is posterolateral. If it is finger penetration, the most common site is anterior is the site. And hymen, so for the micro injuries we use Lugol's iodine. So one more point here, Lugol's iodine. So Lugol's iodine is also question asked in the exam. So Lugol's iodine, that is the test for the micro injuries present over the hymen. Yes. So that's about the question number 5. Question number 6. In civil negligence. So now next question is a very important question. So now we are into the negligence, into the medical negligence. So medical negligence can be civil negligence, criminal negligence, contributory negligence, corporate negligence, patient negligence, so many types. Here the question asked in the exam, in the civil negligence, case against a doctor who bears the onus of proof. Who has to prove the civil negligence in court of law? Anyone? Who has to prove the case in case of civil negligence? See, civil negligence, I'll write here, civil negligence, it is a minor negligence, or you can say non-gross negligence. It is a non-gross negligence. There can be n number of examples. So even minor negligence, like example, wrong diagnosis. So many things are there. Anything that is non-gross is civil negligence. So it is handled by civil court. And remember, civil negligence, patient has to prove. The patient has to prove the negligence of the doctor in case of civil negligence. So answer for this question is patient. The patient is the correct answer. If the same question asked criminal negligence, the criminal means gross negligence. Let me write this criminal also. Okay. So criminal negligence. So criminal negligence is a gross negligence, very gross negligence. Like example, there is a movie Arjun Reddy. There are many movies are there about the negligence. Gross negligence is recently asked in exam. Gross negligence is punishable under criminal negligence. It is punishable under 304B. So 304A, sorry, 304A IPC. 304A IPC, the punishment is 2 years of imprisonment. 2 years of imprisonment. And remember, in criminal negligence, doctor has to prove his innocence. So who has to prove? Doctor has to prove. So doctor has to prove his innocence. Innocence. So this is the very good question asked in the exam. So all of you remember, doctor has to prove the innocence in the criminal negligence. Patient has to prove the negligence of doctor in civil negligence. So these are very important points that asked in the exam. And remember, consent is a very good defense. It's a very good defense in case of civil negligence. So this can be asked in the exam. All of you concentrate. Consent is a very good defense mechanism in case of civil negligence. But the consent is not a good defense in criminal negligence. Let me discuss with the example. Now look at this, all of you. So look at this picture, all of you. What type of negligence is this? Civil negligence or criminal negligence? You can see the instrument in the abdomen. My question is, what type of negligence and who has to prove the negligence here? Or who has to prove the innocence? Anyone can you guess? Anyone can you guess here? Anyone can you guess? Come on all of you. Yes, beta, all of you. Yes, okay. Yes, criminal negligence, anonymous, Neelam Bhatia, Satyan Raja, Joseph, beta, this is criminal negligence. Excellent answer. This is the criminal negligence, punishable under 304A IPC. It is also known as res ipsa loquitur. Res ipsa loquitur. So this question can be asked in the exam. Res ipsa loquitur. The fact speaks for themselves. So doctor has to prove his innocence here. Doctor has to prove his innocence. Okay, yes, very good. Many answered, beta. Very good. Next, here, look at this, all of you. Newspaper headline: doctor accidentally amputate wrong limb. Now my question is, what type of negligence is this? What type of negligence is this? Can you guess, all of you? Can you guess now? Yes, Neelam Bhatia, yes, healthy pill, yes. So this must be again criminal negligence. So punishable under 304A IPC. What is the punishment? 2 years of imprisonment. Consent is not a good defense. Contributory negligence is not a good defense. It is handled by the criminal code. So doctor will go to jail in criminal negligence. So this is what you must know. Next, look at this. Look at this example. So newspaper headline: doctor, nurses convicted for medical negligence. So it is a criminal negligence. Okay. So remember the question asked in the exam. So criminal negligence, please remember, doctor is convicted for at least or maximum up to 2 years in case of 304A for gross negligence. Okay. Yes. So that completes the question number 6. Question number 7. So all of you, my dear students, so yes, now we are into the question number 7. So all of you concentrate. Which of the following poison can be found even in skeletonized remains of the body? Skeletonized remains of the body. Yes, come on. Yes, come on all of you. 7. So skeletonized remains, that means it is the bone. The question is about the bone. So bone means, remember, heavy metal. So bone means that is heavy metal. So what is heavy metal given in the question? So the heavy metal given in the question is arsenic is the correct answer. So answer is very simple. Arsenic is the correct answer. Carbon monoxide poison, you know, so carbon monoxide is an asphyxiant, cherry red discoloration. All this can be asked in the exam. Remember, carbon monoxide, cherry red postmortem hypostasis, cherry red PM hypostasis. PM hypostasis is the question asked. Okay. Yes. Hydrogen sulfide. Remember, this is also question asked in the exam. So let me discuss about hydrogen sulfide. Hydrogen sulfide is also known as a drainage gas. Okay. So it inhibits, you know, electron transport chain. Complex number 4. Complex 4 actually. So carbon monoxide also inhibits complex 4. Cyanide also inhibits complex 4. Hydrogen sulfide also complex 4. They are all asphyxiants. Phosphorus, especially yellow phosphorus is poisonous. Yellow phosphorus is poisonous. Yellow phosphorus is also known as white phosphorus. So there is a syndrome caused by phosphorus asked in NEET PG exam, smoking stool syndrome. So all of you remember, smoking stool syndrome is the question asked in one of the exam. So in a patient with the phosphorus poison, you will see the yellow color effervescence or the fumes from the feces. So that is known as smoking stool syndrome, that can be asked in the exam. Remember, red phosphorus is non-poisonous. Only the white or yellow phosphorus is poisonous. It can lead to phasia, smoking stool syndrome. It can lead to hepatic necrosis. One of the differential diagnosis is the, you know, fatty necrosis of the liver. So many things that can be asked in the exam. Yes, come on. Now about the arsenic. So arsenic, all of you, one more very important topic. So let me discuss. So arsenic. Arsenic is a heavy metal. So all of you, my dear students, how is the Josh, my dear students? Shall I discuss arsenic? Shall I discuss arsenic for 5 minutes? It's a very important question. The mnemonic is Bonaparte. Mnemonic is Bonaparte. You must be knowing arsenic is known as king of all poison. King of all poison. The Bonaparte is the mnemonic for that. Yes, let's see now what are the important question can be asked in arsenic. So B for, anyone can you guess B for? Anyone can you guess B for? B for, yes, come on, B for, yes, come on, B for not Bartonian line beta. Bartonian line is seen in lead poison. It is a non-specific finding in lead poison. So B for, nobody is answering. Come on, Neelam Bhatia, yes, come on all of you. B for black food disease. B for what? Black food disease. So B for BAL. The drug used in arsenic poison is the BAL. That is a very commonly asked in the exam. British anti-levisite, which is given orally or intramuscularly, never intravenously. It causes fat embolism. It causes black food disease. Gangrene of the foot is known as black foot disease. So B for black foot disease. Now O for, anyone can you guess what is the O related to arsenic? Come on all of you. O for it causes oxide. Remember, oxide, that is the arsenic trioxide. So this can be asked in the exam. Arsenic trioxide is the most toxic form. One of the NEET PG exam, INICET exam question was asked, what is the fatal dosage? Your answer should be 120 to 200 milligram. 120 to 200 milligram. N for neoplasia. Arsenic is a well-known neoplastic agent. It causes bladder cancer, skin cancer, lung cancer. It causes neuropathy. So this is also asked in exam. So neuropathy, remember, neuropathy is a mixed neuropathy. Mixed neuropathy. So mixed neuropathy. Anyone, what is the neuropathy caused by lead? What is the neuropathy caused by lead? Anyone can you guess? What is the neuropathy caused by lead? Your answer should be pure motor neuropathy. So pure motor neuropathy. Yes. AFR, you will see A. Anyone can you guess AFR? AFR, Aldrich-Meesline. Aldrich-Meesline. You will see alopecia, anemia, Addison's-like disease. All is an MCQ. P for peripheral neuropathy. Penicillamine also can be used. A for Aldrich-Meesline. That is recently asked in exam. So Aldrich-Meesline. Remember, Aldrich-Meesline also can be seen in some other poison. Anyone can you guess what is the some other poison in which Aldrich-Meeslines are visible? Aldrich-Meeslines are visible in, let's see now, chocolate question now. Anyone can you answer? Anyone can you answer? Aldrich-Meesline also seen in thallium poison. Thallium poison, you must be knowing this. Aldrich-Meesline seen in thallium poison. So all of you write Aldrich-Meesline is equal to thallium in the chat box. So all of you write Aldrich-Meesline is equal to thallium in the chat box. It is asked in NEET PG 2022. Yes, yeah, right, all of you. Next, R, remember, whenever I think about R in arsenic, so triple R and R, raindrop pigmentation. So what is that? Raindrop pigmentation, rigor mortis last longer, retard putrefaction, red velvety stomach, Rin's test, all this can be asked in the exam. Okay, 4 R are there. Raindrop pigmentation hoga, rigor mortis, retards are, you can say forever, for longer, retards putrefaction, red velvety stomach, Rin's test, all these are the examples for that. Okay, next, T for teratogen, E for enteritis. So, you know, arsenic causes rice watery stool. It is mistaken for cholera. So, cholera resembling disease. Your answer should be arsenic. Arsenic is known as the king of all poison. It is one of the ideal homicidal agent. So, it is ideal homicidal because it is a colorless, tasteless compound. It can be mixed with any food and drink. One of the commonest source is the water, that is also asked in the exam. So all these are important question. Heavy metal is the one important topic. You know, arsenic, lead, mercury, thallium. So all these are very commonly asked. So I'll give you some more videos on that. Go through that. Definitely there will be 2 to 3 questions from the heavy metal poison. Okay. Yes. Now, so this is about the, yes. Now next, look at this. All of you identify this. What is the finding here? All of you, come on now. Come on. What is the finding here? The finding here is the black foot disease. I know. So this is the black foot disease. Black foot disease. Second. Yes. Yes. Come on. Next, look at this. What is this compound? Beta, all of you identify. What is this compound? What is this compound? White color compound. White color compound, you can see here, white compound. What is this compound? Anyone can identify? Anyone? All of you interact with me. Yes, beta, it's very important topic, so you have to interact with me. So this is actually known as arsenic trioxide. This is Sankhya. Okay, this is Sankhya, also known as arsenic trioxide. Okay, arsenic trioxide. So this is known as arsenic trioxide. So As2O3, arsenic trioxide. It's a colorless, tasteless compound, can be mixed with any food and drink. Now look at this. So what is the finding here? Image based question. Now look at this. Yes, look at this, all of you. What is the finding here? This is very simple question. Very simple question. What is the differential diagnosis? Differential diagnosis is thallium poison and arsenic poison. Arsenic poison. This can be asked in the exam. Next, fourth. Look at this fourth question. Fourth question, all of you identify this. You can see here finding. You can see the white, hyperpigmentation area. So what is this known as? So this is known as raindrop pigmentation. One of the very important sign in case of arsenic poison. Arsenic poison. Yes. Okay. Next. Now look at this. The fifth one. We remember this is the red velvety stomach. Red velvety stomach. Red velvety stomach. Red velvety stomach. So once again, I'll repeat all of you. There are 5 images we discussed in the class. One is a black food disease, is the gangrene of the food caused by arsenic. Arsenic trioxide, most toxic compound. Aldrich means line, raindrop pigmentation. Lastly, red velvety stomach. Leathery stomach is seen in, where it is seen? Carbolic acid. Good. Next question. Next question. Question number 8. Question number 8. A child who is victim under POCSO. POCSO. We discussed many times in our classes. The POCSO means Protection of Children from Sexual Offences. Brought to Department of Forensic Medicine for age estimation. So for age estimation. The X-ray of the image hand is given shown below. What is the likely age of the child? 4 years, 7 years, less than 18 years, 10 years. So what is the best answer? What is the best answer for this question? Anyone can you guess? Anyone can you guess? Anyone can you guess answer for this question? Yes, come on. Yes, we'll discuss this question later. Now before that, we will see what is the age of ossification of carpal bones. So now we are into the identification, all of you. Some identification, especially X-ray, is very commonly asked. Yes, come on. Okay. Now look at this carpal bone. Carpal bone. So there are 8 carpal bone. You must be knowing. She looks too pretty. Try to catch her. So now capitate. Remember, capitate is the largest carpal bone. So you can see here, this is the capitate. So this is the capitate. Largest carpal bone, which appears at the age of 2 months. 2 months is the correct answer. Capitate at 2 months. Hamate when it appears at the age of 2 months. Triquetral, 3 years. So how to remember? All of you remember triquetral. Tri is there. Tri 3 and all. That is 3 years. Lunate is a half moon shaped or moon shaped. Moon, there are 4 alphabets are there. So that is a 4 years. Scaphoid, that is yes. The S looks like 5. So scaphoid appears at 5 years. Trapezium, trapezoid, they are like brothers. They appear at 6 years. Physiform, physiform is a very small bone. That is the last bone to appear in the wrist. That is laziform, that appears at the age of 9 to 11 years. 9 to 11 years. So this is over. Remember, carpal bone never fuse. So they only appear. Now look at this, all of you now. With this, all of you. With this 9 to 11 year. Come back to this. Okay. You can see here, this is the capitate. So capitate you can see here. So capitate means that is more than 2 months. So you can see here capitate. Okay. Next to capitate is hamate. Next to capitate is the hamate. Hamate as a hook. So more than 2 months. You can see here hamate. So capitate is over, hamate is over. Next is the triquetral. So triquetral also appeared. Triquetral also appeared. That means more than 3 years. More than 3 years. But physiform is not appeared. You can see here physiform is not appeared. So look at this. Both are trapezium and trapezoid. Trapezium and trapezoid. So trapezium and trapezoid. So both appear at the age of 6 years. So more than 6 years. 6 years. Look at this. This is the scaphoid bone. So this is the scaphoid bone. So this is more than 5 years. More than 5 years. But the physiform is not appeared. So physiform is not appeared. So with this, all of you, the better answer for this question is So that is B is the correct answer. So more than 7 years, less than 18 years is the correct answer. So you can see the lower end of radius also. Lower end of the radius here. Anyone? When lower end of radius appears? When this lower end of radius appears here? Anyone can you guess? Lower end of radius. Lower end of radius that appears at the 2 years. But the lower end of radius fuses at 18 years. Lower end of ulna appears at 4 years. Fuses at 18 years. So there is no fusion here. So there is no fusion. There is no fusion of radius and ulna. You can see here there is no fusion of radius and ulna. So your answer should be more than 7 year, less than 18 year is the correct answer. Right? So more than 7 year, less than 18 year is the correct answer for this question. Yeah. Now look at this. Now this question. Now can you guess what is the age of this person? What is the age of this person? You can see here all the carpal bone appear. All appeared. All appeared. Radius fusion also. Radius fusion also. What is the answer? Anyone? What is the answer for this question? All of you see here. What is the answer for this question? Anyone can you guess now? Anyone can you guess? Anyone can you guess? Guess what is the age of the X-ray given in the picture? Come on, come on, come on, all of you. Come on, beta. Come on, come on. Yeah. So your answer should be more than 18 years. So more than 18 years. So more than 18 years is the correct answer. Yes. Next, NEET PG 2021. Yes. Now this question is the next question. A guy was playing in the garden. Suddenly he collapsed and was rushed into the hospital. His friend who played with him in the garden informed the doctors that he had eaten one of the fruit in the garden. He developed irritability, restlessness, dry hot skin, was unable to pass urine and stool, identify the poison and appropriate antidote. See here, what I can see here, dry hot skin, restlessness, irritability. So all this go in favor of a deliriant, and I go in favor of Datura poison. So Datura poison, and in Datura the drug of choice is very simple, physostigmine. Your answer should be physostigmine is the correct answer. So prolidoxam is not used, not the answer. Digoxin is not used, yellow oleander is not the answer. Physostigmine, yellow oleander is also wrong answer. So answer for this question is B is the correct answer. So B is the correct answer for this question. So Datura is one of the very commonly asked topic. You must know in and out of the Datura. I will discuss few points about the Datura. So Datura fatal dose is 1 gram, around 100 to 125 seeds. The fatal period is around 24 hours. So it is characterized by 90 manifestations. What are 90 manifestations? There can be dysphagia, there can be dysarthria, there can be dilatation of blood vessel, there can be diplopia, dry hot skin, drunken gait, delirium. You know, delirium is known as muttering delirium. So, and it is also characterized by carpolagia. The patient will be, removing some threads from the fingers. That is known as carpolagia. That can be asked in the exam. Muttering delirium and carpolagia both are very important findings of Datura poison. Drowsiness, it is a deliriant. It causes drowsiness. Dryness of the mouth. Treatment is gastric levels. Physostigmine is used. Pilocarpine is also used. Now remember, so this Datura is also known as thorn apple. You can see here thorn apple. You can see the spikes. You can see the spines over the fruit. So it is known as thorn apple. And also one more point you must know. So this is the Datura seeds. Anyone? Anyone? What are the features of datura seeds? That is also can be asked in the exam. What are the features of datura seeds? You know, datura seeds are brown in color. They are double-edged. They have a central, they are kidney shaped. The fatal dosage 100 seeds. So it contain, some amount of atropine, some amount of, hyoscine, hyoscyamine and all. That's all very important topic. And you just note down, datura is the must read topic in the exam. Datura is a deliriant. It is also known as datura fruit, also known as thorn apple. It contains hyoscine, hyoscyamine and some traces of atropine. So it increases the level of atropine. There will be signs, they are known as 9D manifestation. And remember, datura is a road poison. It can be used in robbery, in case of trains and buses, and all results it can be asked in the exam. Yeah. Anyone in the class, what is the fatal dosage of strychnine? What is the fatal dosage of strychnine? Anyone can you guess? What is the fatal dosage of strychnine? Anyone can you guess? My question is, what is the fatal dosage of strychnine? What is the fatal dosage of strychnine? What is the fatal dosage of ricin? What is the fatal dosage of datura? So this is a very important topic. Anyone can you guess? What is the fatal dosage of strychnine? Very good, Sandhya beta, very good answer. Sandhya, she answered the fatal dosage of strychnine is 1 seed. It is 1 seed. Ricin 10 seeds. 10 seeds. Datura 100 seeds. 100 seeds. So you can remember like this: 1, 10, 100. Strychnine, ricin, datura. Okay, so this is the one way to remember. Okay, yes, good, good. Many answered, very good. Yes, good. Yeah, now into the next question. Next question. Okay, yes. So, next question. Identify the lesion shown in the image below. Shown in the image below. Yes, come on. So, it is options are confusing, options are there. There are some confusing answers. Laceration, incised wound, laceration looking incised wound. Okay. Incised looking laceration. Yes, incised looking laceration. Yes, all of you, it is definitely not incised wound. So let's see what are the important finding here. You can see here irregular margins. You can see the irregular margins. Irregular margins are there. You can see here irregular margins. And also you can see here irregular margins. You can see here irregular margins. Irregular margins are there. Then there is a bridging of tissues. And there is a bridging of tissue. So bridging of tissues. Okay. And it appears at the bone. Bony prominences. So I think you got the answer, all of you. The laceration which appears on the bony prominences. Irregular margin. Bridging of the tissues. What is the answer, all of you? Your answer should be, yes, your answer should be, that is incised looking laceration. It is an incised looking laceration. It is also known as split laceration. Split laceration. So all of you please remember, laceration is very commonly asked topic. Very commonly asked topic. You must know in and out of the laceration. Laceration caused by blunt object. There are different types of laceration. Split laceration, avulsion laceration, stretch laceration, cut laceration. So there are many types are there. So all of you go through the types of laceration in detail. It's one of the very commonly asked topic in the exam. Yes, now inside looking laceration, that is known as split laceration. Any doubt in this you can ask me? Any doubt in this question number 2? Any doubt in this question number 2? Come on. Any doubt in this? Any doubt beta? Any doubt? Split laceration is the most common laceration. Most common laceration. Yes, Tharakantha dos, Neelam Bhatia. Yes, Capricorn, Mr. Daliwal, yes, come on. Any doubt in this you can ask me, otherwise I will just move. So inside wound has a regular margin, Okay. So laceration you must know in and out. So yes. Next question. Question number 3. A man working in a field, he suddenly collapsed. So he suddenly collapsed. On examination, there were no physical signs of dehydration. His serum electrolytes level was normal. Doctor found that the body temperature was 106 degree. So there is a hyperthermia. So what you can see here, hyperthermia is there, and there is a collapse, So it must be a case of heat stroke. So remember, in heat stroke, sweating is absent. Okay, sweating is absent. What is absent in heat stroke? Sweating is absent. What happens, all of you, when body temperature is more than, more than 106, 107, so there is a failure of hypothalamus. So the maintenance, the higher center present in the hypothalamus, so they are not working. So there won't be any sweating. So answer for this question is least likely to be seen. So all of you remember, this is least likely to be seen. Hot skin can be seen, not the answer. Hypotension can be seen, not the answer. Disorientation, no. Your answer should be sweating is the correct answer. Sweating. So remember all of you, so burn injury is very commonly asked. Rule of 9. So Browder formula, lightning, electrocution, all these are very important topics. You must know in and out of that. So here I discussed whatever required for the question, that is the heat stroke. Next question. A young teenage boy with a history of drug abuse. So he is a case of drug abuse. Had been instilled with a shot of intravenous cocaine. So patient is having signs and symptoms of cocaine poison. So patient is having diaphoresis, headache, acute coronary spasm. Which of the following symptom noted would go against the likely diagnosis of cocaine poison? Anyone can you guess? For this question? Yes, come on. Yeah. So myocardial ischemia can be seen. It is true. Hyperthermia, that can be seen. That is also true. Agitation, that is also true. Your answer should be bradycardia. So answer should be B is the correct answer. Remember, there will be tachycardia. Tachycardia, that is seen in case of cocaine poison. So cocaine is a very important topic. So let me discuss, because cocaine is asked in INICET. It is also asked in your NEET PG exam and also FMGE exam, many exams. So cocaine is something very, very important topic. You can say ultra important topic. So what cocaine will do? The cocaine will inhibit the reuptake of norepinephrine in the brain. So what it will do? It will cause increase in the levels of norepinephrine. So the fatal dosage is 1 gram. So that is also can be asked. What are the routes of cocaine intake? So one is, that is the smoking, that is known as smack. So this is known as smack, or this is known as skin popping. There are two important things, skin popping and the smack. Let's see now, whenever there's an increased norepinephrine, what are the signs of norepinephrine? There can be diaphoresis, euphoria, all this BP, all this that is seen. So it is from a plant known as Erythroxylon coca plant. And snorting and skin popping we discussed. Aphrodisiac means it increases sexual desire. So cocaine is a well-known aphrodisiac. Crack is smokable. There are different stages of cocaine poisoning. Stage of excitement. What happens? Suddenly there will be increased levels of norepinephrine that leads to hypertension, that leads to intracerebral bleeding also. That can be possible in case of cocaine poison. There can be stage of depression that is characterized by perspiration, and the treatment is amyl nitrate. So this can be asked in the exam. But what I am actually telling you here, in case of chronic cocaine poison, you will see a condition known as formication. Formication. That is also known as cocaine bugs. It is also known as cocaine bugs, characterized by injection mark, characterized by some scratch mark. You will see the scratch mark. So I think some student, they remember this question asked in INICET exam. A patient, a well-known case of some addiction, there were scratch marks were there on the body. That is known as formication, that is known as tactile hallucination, that is known as cocaine bugs. Okay, so this is about the cocaine, and you must know in and out of the cocaine. So whenever in exam scratch marks are given, think about cocaine, that is the tactile hallucination. Yes. Now next question. The below phenomena is due to. So this is a good question asked in the exam. So all of you try this question. Try this question now. Try this question. Below phenomena. What I can see here, one classical finding in drowning. So what I can see here, it must be a case of washerwoman hand. So this is a washerwoman hand. Washerwoman hand. Washerwoman hand. So now what do you think? Is a case of torture phalanga? No, I don't think phalanga is a type of torture. So torture is also very commonly asked. So please remember, all of you, types of torture. Phalanga means that is the beating on the palm and soles. So there is no bruises and all. There is no bruise, nothing, abrasion, nothing is there. So it is not the answer. Case of suspension, hanging more than 72 hours? No, it is not a postmortem hypostasis. It is not a postmortem hypostasis. Postmortem hypostasis, normal color is purplish red. That is not same. Case of colligative liquefaction? No, that is not the answer. Colligative liquefaction will not look like this. So case of immersion, water more than 36 hours. So this is the washerwoman hand. Okay, so washerwoman hand, what happens actually, there is a water imbibition. When there is a water imbibition between the epidermis and the dermis in case of drowning, so there can be washerwoman hand. So there can be peeling of the skin, there can be deglowing injury also. That is all very commonly asked in the drowning. So drowning is a one very important topic asked in the exam. So let me discuss about drowning only the image based questions. Yes. Yes. Next question. So what are the autopsy finding in drowning? So now let me discuss some image based questions. All of you ready? So all of you ready for the image based question? Come on, say yes in the group. Come on, say what are the image based question in drowning? Drowning is a very important topic. Drowning can be freshwater drowning, salt water drowning, near drowning, dry drowning, secondary drowning. All these are very important topic. You must know in detail. Now I will only discuss what are the autopsy finding, what are the image based questions in the drowning. So all of you identify this. What is this finding in drowning? What is this finding in drowning? All of you identify this. Now let's make it interactive. Let's make it interactive. Come on, Priyanka. Yes, come on, Priyanka. Yes, Arshad, Sandhya, Anirudh Mishra, Anis, Dami. Yes, come on. Yes, what is this? You can see here some balloon, some balloon is coming out from the lips, both the side. What is this known as? So this is known as froth. So what is this known as? Froth. Okay. Remember, froth is because of the surfactant plus mucus plus water. So in case of drowning, you will see fresh leathery froth. Fresh leathery froth. But remember, it is non-specific. It is a non-specific finding. Non-specific. It can be seen in OP poison. It can be seen in case of opium poison. It can be seen in snake bite. So froth is not a specific finding in case of drowning. Second, look at this. What is this finding? What is this finding known as? Now all of identify, come on, let's make it interactive. Let's make it interactive. This already we discussed. So we can see the peeling of the skin, water accumulates between dermis, epidermis, so deglowing injury, all this, so that will go in favor of washerwoman hand. Washerwoman hand. So washerwoman hand. So when washerwoman hand is seen in entire hand, so that means it is a case of time since death more than 24 hours. More than 24 hours. And remember, washerwoman hand is also non-specific. Let me write here. Washerwoman hand is also non-specific. Non-specific. This can be asked in the exam. Good. Next. What is this finding? Now, finding number 3. Finding number 3. Now identify this, all of you. So here a case of drowning. You will see dead body with the hand, clenched hand, with the aquatic matter. So what is suggestive of? It is suggestive of antepartum drowning. What is this known as? So this is known as, all of you identify along with me. So this is a case of cadaveric spasm. What is this known as? Cadaveric spasm. Cadaveric spasm is a very, very important question, and it is the surest sign. It is the surest sign of drowning. And remember, cadaveric spasm, there is no primary relaxation. Cadaveric spasm is the surest sign of antepartum drowning. Yes. Next question, all of you. What is this case in case of drowning? Can you identify this? Can you identify this, all of you? You can see a case of drowning. You can see some important, goosebump-like appearance. What is that known as? What is that known as? So this is known as cutis and serina. Cutis and serina. Again, it is a non-specific finding. Non-specific finding. So what happens due to the cold? Due to the cold in case of drowning, so there can be, contraction of the superficial muscles of the skin. That is known as cutis and serina. So there are 4 images, all of you. Froth, washerwoman hand, cutis and serina, and cadaveric spasm. Chalo. Next question. So all of you ready for the next important finding? Look at this. So now here I'll tell you, in this case, patient a case of antepartum drowning. So antepartum drowning. So there was a forceful breathing effort. So because of that, lungs are emphysematous. What is this finding known as? So person was living conscious drowning. Lungs are emphysematous. What is this finding known as? Anyone can tell me what is this finding known as? Living conscious drowning. Living conscious drowning. The 5th finding. Yes, come on. Part of hemorrhage is beta correct. But there is one more word is there. What is that? Anyone? What is that? Come on, beta. Emphysema aquosum. Emphysema. So emphysema aquosum. It is known as emphysema aquosum. It is a feature of conscious drowning. So this can be asked in upcoming exam. What is the feature of conscious drowning? Your answer should be emphysema aquosum. Then look at this. So this is the 6th finding. I think this you can make out. Even UG student can make out. There is a finding here in the bone marrow. So when I examined the bone marrow, I found some important particles in the bone marrow. Like femur sternum is commonly used, which is a feature of antepartum drowning. What is this known as? Anybody in the class? Yes. So this is known as diatoms. So diatoms also can be asked in the exam. What are diatoms? Diatoms are microscopic algae. They are unicellular algae. They have a coat of silica ions. When diatoms are found in the bone marrow and the brain, That is the feature of anti-mortem drowning. That is the very important question asked in exam. The study of diatom is known as forensic limnography, and acid digestion technique is used. All these are important topic we discuss in our classes. So this is enough. Seventh one. What is this hemorrhages? Yes, come on. Now the seventh one. The seventh one, you can see the hemorrhages. You can see the hemorrhages. What are these hemorrhages known as? Now come on, who is going to answer? Yes, beta. Best beta Neelam Bhatia. Beta Neelam Bhatia, you are very active in the group. Sandhya beta, Tarakan, Sandhya, AN, Anonymous, very active in the group. Beta, so you are very active. So yeah, come on. What is this finding known as? So this is known as pult of hemorrhages. So pult of hemorrhages. Pult of hemorrhages. So this is also again, remember, non-specific finding. It can be seen in pneumonia, it can be seen in some other conditions also. Last finding. Okay, so this is about the 8 findings. I think 7 findings we discussed. So once again I will discuss froth, washroom and hand, cadaveric spasm, cutis anserina, emphysema mucosum, edema mucosum, diatoms, fault of hemorrhages. The cause of death is asphyxia. In case of dry drowning, cause of death is laryngeal spasm. And remember, Gettler test, levels of magnesium, all these are very commonly asked in the exam. So I'll just stick to the next topic. Next question. Yes, come on. Next is the 6th question. What is the active principle? Active principle of poison shown in the image. Now what I can see here, so what I can see some heart-shaped, okay, I can see here heart-shaped seeds, heart-shaped seeds, and they are black in color, and also you can see the projection at the end. You can see the projection. Okay, so this is the projection, heart-shaped seeds and all. So my answer is very clear. So this, whenever seeds are given like this, so your answer should be, anyone can you guess? It is yes, very good. This is the marking nut. So this is the marking nut. And the marking nut is also known as semicarpus anacardium. What it is known as? Semicarpus anacardium. What is the active principle? Semicarpal. Semicarpal is there. And one more, that is bilavenolol. So bilavenolol is the correct answer. So what is the answer for this question? Your answer should be bilavenolol is the correct answer. Abrin no, calotropin no, ricin no. Ricin present in Ricinus communis. Abrin present in Abrus precatorius. So calotropis, that is present in calotropis plant. It is not calotropis plant. It is actually marking nut. So marking nut, it is used in abortion. And also artificial bruise. So all of you remember, artificial bruise is a very commonly asked question in the exam. So artificial bruise. So all of you, come on, remember. So heart-shaped seeds, black projection, the black projections are there. That is semicarpal marking nut, used in abortion, used in artificial bruise and all. Ricin present in Ricinus communis. Abrin present in the rati seeds. Calotropis present in the madder juice. All these are MCQ can be asked. Now again, some important pictures are there. You need to identify the picture. So all of you identify this picture now. Come on, beta. Come on. Tarakanta Das, Anis, Dami. Now image-based question. Some images related to plant organic irritants. Come on here. You can see here some shiny seeds are there. Shiny seeds. You can see the brown, black, grey markings. So whenever you see this kind of shiny seeds, very good. Tarakan Das, very good. Anonymous, very good. So these seeds are known as Castor seeds. Castor seeds. Castor seeds also known as what? Ricinus communis. Ricinus communis. Ricinus communis. You know, one of the very famous case, I remember, umbrella murder case. In that case, Ricinus communis was used. It inhibits protein synthesis. It causes, death in 3 to 4 days. Fatal dosage is 10 seeds. So the first question went very well. So shiny seeds, Ricinus communis. Second one, you can see here. What about this? What about this second seed? You can see the red color, very attractive color, red color. So red color, black, red color, so like attractive, like Rati, Manmata, Rati and all, actually. So what are these seeds known as? So these are known as Rati seeds. Nothing but Abrus precatorius. Abrus seeds. Abrus precatorius. Remember in Abrus, so it is used as a animal poison. It is used to kill animals. It resembles like viper snake bite. It is known as Abrus precatorius. Very good. Many answering. Interact with me. That is really great. The fatal dosage 1 to 2 seeds and 3 to 5 days. 3 to 5 days. Here fatal dosage 2 mg per kg body weight, 3 to 4 days and 5 to 10 seeds. So castor we discussed, Rati we discussed. Next, look at this. So this can be asked in upcoming exam. This can be asked in upcoming exam. You can see here there is a plant. There is a plant which has a white flower, or it can be having pink flower. It is used in abortion. It is used in infanticide. It can be used in artificial bruise. Whenever I am giving you so many clues, white flower, artificial bruise, abortion, infanticide, okay, so it is also used by snake charmers. So this must be calotropis. I know, very good. So many they got the answer. Very good, very good. What is the active principle? Calotropin, calatoxin and gigatin. So gigatin is the question asked in the exam. So very important question. Remember this. So gigatin is present in calotropis, especially. So calotropis alba and procera, there are 2 types are there. So anyway, gigatin that present in the calotropis. So that is okay. Yes. Now look at this. What is this fourth one? Anyone can identify this? What is this fourth one? Very simple, all of you. What is the clinical condition associated with this? So these are nothing but capsicum annum. Capsicum annum. Capsicum annum. It produces a condition which causes dermatitis. Over the fingers. So especially, cook, chef. I know what is the condition known as? Now what is that condition known as? Anyone can you guess? What is the condition known as caused by capsicum annum seeds? Remember, this is very interesting name, Hunan hand. Hunan hand. It is known as Hunan hand. Not human hand, beta. It is a Hunan hand. So, okay. Hunan hand is the question asked in the exam. Next, sixth one already we discussed. So, this is the fifth one. This is the semicarpus anacardium. So, this already we discussed. Semicarpus. One more is there. Rarely they will ask. That is the yes, non-shiny seeds. It is known as croton tiglium. So croton tiglium. So once again I'll repeat. So plant organic irritants. So they are of 6 types. One is the Ricinus communis, Abrus precatorius, calotropis, Hunan hand chili seeds, semicarpus anacardium marking nut, and one more non-shiny seeds known as croton tiglium. Sometimes they'll ask about the ergotism also. Ergotism that is caused by the, so that is the fungus. Ergotism, so that is actually, so by Saint Anthony fire. That is also a question asked in the exam. I think you understood the important plant organic irritants. Okay. Any doubt in this, beta? My dear students, how is the Josh, my dear students? So my dear students, how is the Josh? How is the Josh, my dear students? Yes, come on. How is the Josh, my dear students? Yes, come on. Yes, 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 yes. Come on, come on, come on. Yep, yep. Any doubt in this? Any doubt in this? So I'm discussing in and out of the topic. So not only the question and answer, I'm discussing in and out so that you can one even say if you get say 10 15 questions, if you get 5 questions from my class, at least 5 difficult questions from my class, so that will give you 5 4s around 20 marks. So your rank will jump from 1000 to 500, so 1000 to the 500 rank. So forensic is a very easy subject, I agree. At the same time, remember it is a scoring subject. 15 question in your pocket. If you attend 2 days class, our classes, our lectures, 15 questions will be in your pocket. That is the confidence I can give you from forensic medicine. So such an important subject, such a scoring subject is forensic medicine. Yes, yes, yes. Come on. No doubt, है ना? ठीक है. Okay. Next. Sprint. Okay. Next. Which of the following true regarding post-mortem change shown in the image given below? So this is the very nice question. So what I can see here, so you can see the railroad appearance. You can see here like this it is there. So this is known as marbling. So this is known as marbling. So this is also very commonly asked in the exam. So marbling is a feature of external putrefaction. It is because of sulf-methemoglobin. It is a feature of putrefaction. It is seen usually after 24 hours. So after 24 hours, not before 24 hours. So seen within 24 hours, it is wrong. Wrong. Because seen within, no, it is after 24 hours. Due to sulf-hemoglobin, yes, it is a true statement. It is a true statement. Due to aseptic non-bacterial cause, no, it is a wrong statement. It is due to bacterial cause. So putrefaction caused by Clostridium welchi. It is a gas gangrene type of bacteria. So answer is not C. Associated case of lightning, that is also wrong. Okay, wrong it is. So lightning will see filigree burn. So lightning will see filigree burn. Filigree burn. So the filigree burn, so doesn't look like this. It doesn't look like green color. It looks red color. So it is not a case of lightning also. What is the answer for this question then? So answer for this question will be B is the correct answer. So B is the correct answer. So hope you understood this. So next, this is about the marbling. So remember, the first site of external putrefaction is right iliac fossa or under surface of the liver. The first site of internal putrefaction, that is larynx and trachea. The last site is the bone. So all these are very commonly asked. Putrefaction is a very, very important topic, like external putrefaction, internal putrefaction, pink teeth phenomena, Swiss cheese appearance of liver. So all this, skin peeling, post-mortem purging, post-mortem artifact, all these are very important topic. Whenever you're free, so just go through the putrefaction in detail. Okay, yes. Now we are into the next question. Now just let's print, okay. Let's print now all of you. So let's print all of you. Now look at this. There are 3 important findings here. There are 3 mans here, 3 dead man. Okay, 1, 2, 3. So A, B, C. मैं लिखता हूँ इधर. A, B and C. Can you tell me all of you? What are these ABC? What are these ABC all of you? Yes, come on. ABC. Now let's discuss about this. Let's discuss. Okay. Come on. So this is the, this is the putrefaction. Yes, putrefaction. And this is the white color. What is this known as? Adipocere. White in color. Whenever you see calcium salts over the fatty tissues, it must be adipocere. And this is the very good. So this is the mummification. I know. So please remember, all these are very commonly asked in the exam. Mummification. So whenever you see black or brown color, found in high temperature, there is no humid environment, all this go in favor of mummification. Whenever you see warm humid environment in exam, so white in color over the fatty tissues, so in case of some case of drowning, adiposity formation. When you see foul smelling, marbling and all, that is the putrefaction. So this is about the three important questions that asked in the exam. Okay, yes. So all of you, okay, all of you are we enjoying the class? All of you are enjoying the class, forensic class? So just reply me, all of you, just reply me, are enjoying the forensic class? Okay, yes. Next question. Okay, question number 8. Okay, yes, come on, yes, come on. Yep, Sandhya, Roy, Tarakant, Neelam Bhatia, Capricorn, yes, Anonymous, Sun, okay, good, okay, good. So Hatim Hassan, yes, okay, Anonymous, good, fine. Next heading. A guy was sitting on the balcony which was overlooking a park. He always used to sit nude on his balcony, derived sexual gratification by observing the people that look at him. This is already we discussed. So this is a very simple answer. This is the answer is exhibitionism. So answer is, this is the case of flashing. So this is the case of flashing. It is punishable under and all we discussed in our classes. So this is exhibitionism. Good. A woman gave birth to twins. Okay, twins. The father, who believed that they did not belong to him, requested on DNA testing. One child did not belong to him. So this case is best described as. So here it is a case of twinning. It's case of twin to different father. So two different father. So during same cycle. So whenever this question asked, two different father, when two ovumes are released from the same cycle, both are fertilized by two coitus. So maybe on same father or are different fathers. So that is known as superfecundation. So what is this known as? Superfecundation. And remember, superfecundation can be two types. It can be two types. So homopaternal. So it can be homopaternal or heteropaternal. It can be two types. So it can be two types, homo and heteropaternal. Hetero means two different father. Homo means same father. So this is actually superfecundation. So answer for this question is B is the correct answer. What is superfetation? Superfetation means it is actually fertilization of ovum who is already pregnant. So there can be different cycle. So remember, superfetation from the two different cycles, not from the same cycle, and there is at least gap of 1 month, 4 weeks to 8 weeks. That is superfetation. What is suppositious child? That is nothing but fictitious children. That means suppositious child means a female. So what she will do, actually she will show some other child as her child, and she'll pretend that the child belongs to her. That is known as suppositious child, fictitious children. Atavism means here the child resemble like grandparents. So all these are question asked in the exam, very simple. Okay, yes, we discussed about the superfetation and all. Next question number 10. While recording evidence while recording evidence in the court of law, the lawyer as the witness, did A kill B in your presence? So the question asked is leading question. So what is this known as? Leading question. Leading question. Leading question. So leading question, remember, it is a yes or no type of question, or any question which has the answer in it. The witness said yes. This type of question would be permitted in which of the following procedural route in the court of law? Your answer should be cross-examination. Okay. So leading questions are permitted in cross-examination. Okay, cross-examination by opposite lawyer, or you can say defense lawyer. So answer will be C is the correct answer. Yeah. Now we are into the very important topic, recording of evidence in a court of law. So how the recording of evidence in a court of law? Because this question was asked in INICET exam, question asked in NEET PG exam, question repeatedly asked in various platforms. So what is the recording of evidence in court of law? So before that, we will see what are the three characters here in this. Can you guess, all of you, what are three characters here? So what are the three important characters here? Yes, so he is actually a judge, hai na? So he must be a judge, honorable judge, hai na? Honorable judge. And also you can see the two advocates. Two advocates here. I can take him as a public prosecutor. Okay, public prosecutor. And I will take this person or this advocate as a defense lawyer. Defense lawyer. Defense advocate. Okay. True. So there are three characters here: judge, public prosecutor, and the defense lawyer. What are the steps, in case of recording of evidence in a court of law? The first step will be, that is the oath. So the oath, shapat. So that is the first step. In case of any courtroom procedure, the oath is taken. But oath is not done in children less than 7 years of age. In less than 7 years of age, it is not taken. It comes under 51 IPC. 51 IPC. Second, examination in chief. Now, examination in chief, as name suggests, examination in chief is conducted by public prosecutor. What public prosecutor will do, he will explain the court about the contents of the case. What happened in that case, what actually happened in this rape case, a murder case. So that is known as examination in chief. That is conducted by public prosecutor. Public prosecutor comes under section 137 Indian Evidence Act. And remember, in examination in chief, leading questions are not permitted. Leading questions are not permitted. So anyone in the class, leading question can be asked in examination in chief in some condition. Anyone in the class? What is the condition in which in examination in chief leading question can be asked? So all of you, what is the answer? What is the answer, all of you? What is the answer for this question? What is the answer for this question? Examination in chief. So the leading question can be asked. Yes, come on. Yes. Anyone who answer will get the chocolate from me. Kishore Kumar, Anish Dami, Shifana, Tarak Kanta Dasa, Kishore Kumar. So what is the answer for this question? So examination chief. Yes, very good. So the Debojit Mandal, Malati Shri, you are right. In case of hostile witness, in case of U-turn witness, hostile witness, one who changes his statement against the favor of the state. So in that condition, hostile witness, you can ask the leading question. So that can be asked in upcoming exam. So hostile witness means U-turn witness, one who changes his statement during the courtroom procedure. So hostile witness. Cross-examination. The cross-examination by, that is, defense lawyer. By defense lawyer. defense advocate. We can call it a defense advocate. And remember, cross-examination, no time limit. And you can ask, or advocate can ask any type of question. So that can be leading question also. Leading question means yes or no type of question. It comes under 141 and 146 Indian Evidence Act. Next, re-examination. So re-examination of the witness. It is done again by public prosecutor. No leading questions, no new questions. That is known as re-examination. Re-examination again by public prosecutor. Lastly, question by the judge. That comes under section 165 and section 311 CRPC. So judge is the supreme. He can ask any question at any time during the proceeding. That is also NEET PG question. So once again I'll repeat, there are 5 steps: oath, examination in chief, cross-examination, re-examination, court questions. And remember, perjury defined under 191, punishable under 193, giving false certificate is 197. So all these are very, very commonly asked. If you have any doubt, you can ask me. Yes, come on all of you. Come on, any doubt in this? Any doubt in this beta? Yes. So Shifana, Kishore Kumar, Tarakan Das, anyone? So any doubt in this, you can ask me. Come on. Yes, come on. Yes. All of you getting my point? All of you getting my point? So forensic is such a subject. There are so many topics which are not interconnected. So there are some chapters, they are purely different from other chapters. Like example, identification, sexual offences, toxicology, legal procedure, medical negligence. So you can say it's a full of surprises. Yes. Synapse. No. Okay, fine. Next last year question, that is 10 questions are there. So I am going to complete it in half an hour. Okay, complete in half an hour, you don't worry. So yes. So 191, 192 beta, Dr. BGS, remember. So 191 beta, it is the giving false evidence in court of law. 191 is giving false evidence in court of law. 192, fabricating false evidence. You are creating some false evidence and submitting in the court of law. That is 192. In other words, 191, 192, nothing but perjury only. Both are perjury only. One is giving false evidence. Second one is the fabricating false evidence. Like example, some fabricating knife. Some knife which is submitted in the court of law, which is not actually there in the crime scene. It is fabricated by someone. That is 192. Okay. Next to 2022 questions. Now last part of the discussion. Yes. Identify the gun that caused the wound and the range of the shot. So this question asked about the shotgun. Okay. So you can see here there is an entry wound. So there is an entry wound. I can say entry wound. Why? Because exit wound is rare in shotgun wounds. Exit wound is almost rare, almost absent in shotgun. So here, it is probably a case of entry wound. You can see the nibbled margin. You can see the nibbled margin. You can see the rat hole appearance. So what is the answer for this shot? It is not a close shot. In close shot, you will see circular wound, circular. So it must be a case of near shot. Let me discuss about this. Shotgun entry wounds. And here, remember shotgun. Remember, it is a smooth bore weapon. That is the MCQ point. So I'll write here, shotgun is a smooth bore weapon. So all of you remember, shotgun is smooth. So all of you write in the chat box, shotgun is a smooth bore weapon. Smooth means absence of lands and grooves or absence of the rifling. Shotgun is a smooth bore weapon. There is absence of lands and grooves in the shotgun. Okay, so that is a very important point. In shotgun, remember, the range is 30 to 40 meter. 30 to 40 meter. Very good. So good question. Good. Some students are answering. Some students are interacting with me. That's really great. So shotgun, there are 5 types of wounds. What are 5 types of wounds? One is the contact shot, close shot, near shot, intermediate shot, and distant shot. So there are 5 types. Okay. So first one is that is the first one. You can see here. So this is the contact shot. This is the contact shot. So you can see the cruciate type of entry wound. So this is the contact shot. In contact shot, you will see the blackening that is inside the track. So that is known as contact shot. So second one is the close shot. So in close shot, you will see oval or round opening, round entry wound. So whenever you see oval or round entry wound, that is the close shot. Okay, you can see here blackening also. So you can see the blackening also. You can see the singeing also. Whenever you see this type of picture, it must be close shot or it is the contact to close shot. This is usually close shot. Now look at this. So you can see here rat hole appearance. Whenever you see nibbled margin, it must be a case of near shot. So it is a case of near shot. So third one is the near shot. So near shot is the question. It is between 1 to 2 meters. 1 to 2 meters. 1 to 2 meters, you will see the rat hole appearance of that is the shotgun entry wound. Now intermediate shot. You will see intermediate shot here. You can see the intermediate shot. Intermediate. I'll write here intermediate. Intermediate. In intermediate shot, remember what you can see here. You can see, intermediate. This is intermediate shot. Okay, this is intermediate. So all of it, just a correction, you do it. So this is the intermediate one. This is the intermediate, and this is the distant. So this is the distant. In intermediate, so in intermediate, what you will see? You will see the large entry wound. You will see a large entry wound surrounded by small entry wounds. Surrounded by small entry wounds. So it looks like a satellite. It looks like a satellite wound. Satellite wound. Like example, sun is there. Sun surrounded by these small stars. So it is a satellite wound. Whenever question asked in the exam, satellite wound is seen in. The satellite wound is seen in case of intermediate range between 2 to 4 meters. 2 to 4 meters. 2 to 4 meters. Distant shot usually more than 4 meters. More than 4 meters. You will see the only small pellet holes. You will see the small pellet holes. No satellite wound. So this is the question asked in the exam. Okay. So close shot means that is between less than 1 meter. Contact shot means contact with the body. This is the contact shot. Close shot, near shot, intermediate shot, and that is distant shot. And in shotgun, remember, exit wounds are very rare. So now here a homework for you, all of you. What is billiard ball phenomena? So this can be asked in upcoming exam. So billiard ball phenomena. I'll write here. So this is the homework for you, all of you. Just go through this. What is billiard ball phenomena? What is billiard ball phenomena? Okay. What is Royal-Seymour phenomena? What is Royal-Seymour phenomena? Royal-Seymour phenomena. What is Kennedy phenomena? What is Kennedy phenomena? So these 3 questions that can be asked in the exam. Yeah. So this is okay? Fine. Now next question. Identify the type of wound from the image. So you can see here some stab wound are there, some stab wound or some incised wound. So incised wound is there. So you can see multiple are there. So multiple over the web space. So web space it is there. So what is this? So this I think it is definitely antemortem only. Antemortem it has a vital reaction and all. So it can be B is also okay, fine. And C is definitely not the answer. It is not hesitation cuts. Hesitation cuts are common over the wrist, not over the case of the palmar aspects of the fingers. So answer can be A also and also B. So better answer for this question is A is more than B. It can be defense wound. So the examiner is asking whether you know about defense wounds or not. So he is asking whether you know defense wound or not. Says definitely defense wounds are antemortem, but the accurate answer is the defense wound. Defense wound is the correct answer. Now defense wound. See, defense wound basically of two types, active defense wound and a passive defense wound. So they are seen in a case of stab injury or incised wound when the person or the victim try to protect himself from the wound. He will try to protect, he will try to hold the weapon, he will try to give the hand like this. So this is known as defense wound. Defense wound can be two types, active defense wound and a passive defense wound. So this is the active defense wound. You can see here, so this picture, this is the active defense wound. Active defense wound. Active defense wound, when person try to protect himself, try to grab the weapon from the assailant, that is known as active defense wound. Passive defense wound, so this is passive. Passive. So what he is doing here, he is actually trying to protect by giving hand like this, So they are active and passive. Whenever you see in the palmar aspect, whenever you see in the web spaces, it should be active defense wound. Whenever you see in the back of the hand, back of the wrist, dorsal aspect, it must be a passive defense wound. So both are very, very commonly asked question in the exam. So defense wounds, so the wounds can be two types, active and passive. Now my question all of you, defense wound, they are absent in certain cases. So anybody, what are the cases in which defense wounds are absent in case of murder? Anyone? Anyone can you guess? Defense wounds, what are the conditions in which defense wounds are absent? So defense wounds are absent in unconscious patient, semi-conscious patient, or when a victim suddenly attacked from the person, attacked from the behind, unconscious person, under influence of alcohol and drug, taken by surprise. In all this condition, defense wounds are absent. So all these are extra point taken from K.S. and Reddy and Anil Agrawal textbook of forensic medicine. So this is not given in any other small textbooks, given in the standard textbook. Defense wounds are absent in. So all these are the conditions. Good. Next. Question number 3. Now into the very important topic. So that is about the lead poison. So lead poison. Okay. Yeah. A 56-year-old man presents with the fatigue. So he's having fatigue. He's having pallor. He's having abdominal pain. See, in case of lead poison, the commonest clinical finding will be abdominal pain. So this can be asked in the exam. So commonest clinical finding, clinical presentation in lead poison is abdominal pain and the constipation. Patient is having memory loss. He was working in a battery recycling plant. He has a food drop. Okay, so patient is having food drop. So patient is having abdominal pain, and also there is high levels of lead. So all go in favor of lead poison only. So lead poison we discussed many times in our classes. Lead poison or lead will inhibits, so that is dehydratase enzyme, amino levulinic acid or ALA dehydratase, and also ferrochelatase. So two enzymes are inhibited by the lead. ferrochelatase and also ALA dehydratase enzyme. Okay. So it is not the pyruvate dehydrogenase, uroporphyrinase 1 and 2. So they are important in porphyrins and all, you know. Pyruvate dehydrogenase inhibited by the arsenic. So let's see now, you know, lead is something very commonly asked. You know, the most common source of lead poison is the air. That is the one commonly asked. It is occupational disease also. It is also known as plumbism. It is also known as saturnism. Okay. Lead poison is also known as saturnism. So all of you write in the chat box. Lead poison is equal to saturnism. All of you write an extra point. Lead poison is equal to saturnism. So all of you write ferrochelatase. Beta ferrochelatase. Lead poison is equal to saturnism. This is very important topic. So all of you just concentrate. The mnemonic case starts with A, B, C, D, F, G, H, I, O. So that's a very simple mnemonic which I prepared, which I teach in my usual classes. So A for saturnism. All of you write saturnism because in exam there can be a question which of the following poisoning known as saturnism. So that is lead poison. Okay, lead poison causes motor neuropathy. Yes, A for what? See, lead poison, you know, whenever I remember A in lead poison, I remember ALA dehydratase and ferrochelatase. And also remember anemia also, and not Aldrich means line. Okay, so A for anemia, it can lead to abortion, it can lead to, you know, accidental poisoning also. The most common source is the air is the most common source. All of you once again remember arsenic poison, the most common source is the water. Here it is the air. Anemia, it causes, you know, anemia, that is like iron deficiency anemia, because of inhibition of two important enzymes. It can lead to abortions, especially lead oleate. So this can be asked in the exam, lead oleate. So which is the lead compound used in abortion? Lead oleate is the correct answer. Yes. Yes. Second, B for, see, whenever I remember B in lead poison, so ये होगा Burtonian line. So B for Burtonian line, basophilic stippling. Okay, Burtonian line, basophilic stippling, and it is because of what? Lead sulfide. So this can be a springed point. Why there is a Burtonian line? Because of the lead sulfide. And remember, Burtonian line is not a specific finding. It is a non-specific finding that can be seen in other conditions also, like copper poison also, mercury poison also. That can be seen in some other various conditions. There can be bands also. B for bands, radiopaque bands are seen. Ball is used. Even in children, you know, there can be radiopaque bands in the X-ray, that is the finding. All are, you know, spring points. C for C. All of you remember what is C in lead poison? C, all of you C. Yes. Come on. Iranna beta. So can I answer this question? C for C. Yes, C for. Very good. Colicky constipation. That is the most common presentation. Okay. Colicky constipation also. Chronic renal failure also. Calcium EDTA is also used. See, lead poison, arsenic poison, mercury poison, all these are very, very important topic. So there is around 40-45 minutes video that I'll provide you. Go through that video and definitely you will get a minimum 2 or 3 questions. C for constipation. D for what I remember, drops. There can be wrist drop, foot drop because of the motor neuropathy caused by the lead. I just write here. So this is the motor neuropathy at the level of 60 to 80 microgram. So this is taken from standard textbook. At the level of 60 to 80 microgram, there can be drop. Then E for, anyone can you guess what is E for? What is E for in lead poison? Lead poison, E. So E for encephalopathy. Encephalopathy, that is common in children, not common in adults. What is the level of lead? Your answer should be 80 to 120 microgram. So Iranna, yes, Iranna, Priyanka, Rushi and Tarakanta Das, beta, very good, all are very attentive. Encephalopathy and tetraethyl lead. So it is mixed with a petrol. Okay, it is commonly associated with your brain. You know, brain. So encephalopathy associated with tetraethyl lead. It is an anti-knocking agent used along with the petrol. Facial pallor. So this is also very commonly asked. Facial pallor. If the question asked in exam in lead poison, earliest finding in case of lead poison, your answer should be facial pallor. So facial pallor either because of vasospasm or because of the anemia also. That is all caused by the lead. Facial pallor, that is F. Then we'll think about G. So G, anyone, can you guess? G, can you guess anyone? G, come on. G for gout, King's disease, gout. It can be aggravated. And H for, there is a hypertension. I for impotency, interstitial nephritis. O for lead oleate. So treatment, you can use ball, you can use penicillamine, you can use calcium EDTA. So this is also very commonly asked in the exam, calcium EDTA. So all these are very important topic. Now it is the springtime. For image based question. Now let's see how many of you going to answer these 5 questions. Come on, all of you. Come on. So what is the finding here? Come on. In a case of lead poison, what is the finding here? The finding is Bartonian line. So Bartonian line. So it is the Bartonian line. Okay, yes, good. Come on, yes. So sorry, it is not, but this is basophilic stippling beta. Okay, basophilic stippling. It is basophilic stippling. So Bartonian line we'll discuss later. Okay, it's a basophilic stippling. So you can see the basophilic stippling in the RBCs. So yes, next. So look at this. This is the lead band. So this is the lead band. Look at this. So this is the classical Bartonian line. So this is what Bartonian line. So Bartonian line, it is seen at the junction of teeth and the gum. It is a non-specific finding because of the deposition of the lead sulfide. Next question. So that's about the, that is about the lead. Next, question number 4. A 45-year-old female is told about the benefits, complications of hysterectomy. She agrees to the procedure. She agrees. So, all the complications of hysterectomy, all the complications of the hysterectomy and alternative procedures, all these are explained and the written consent is taken. So what type of consent is this? So this is the very simple. So whenever you take consent, so it can be, consent. So consent can be 2 types. It can be implied consent. It can be informed consent. Again, informed consent or written consent can be oral consent. It can be written consent. So it comes under Indian Contract Act. Okay, Indian Contract Act. So consent. So here is the informed consent. So answer is A is the correct answer. What is implied consent? See, implied consent means it implies the action of the patient itself implies that consent is given. Like example, a patient is waiting for you in the clinic or patient is waiting for you in the nursing home. So that implies that the consent is given for inspection, palpation, percussion, auscultation. So that is known as implied consent. So implied consent, the patient, the presence in the clinic, that implies that consent is given for the examination. Not for a diagnostic purposes, not for the surgery. It is only exceptions for consent. What are the exceptions? What are the exceptions, anyone? What are the exceptions for the consent? Anyone, can you guess? Anyone, can you guess? Beta? Yes, come on. Anyone, can you guess? What are the exceptions? Exception means consent is not taken. You can do surgery even without the consent. What are the exceptions for the consent or informed consent in some condition? So what are some condition? Yes, anyone can you guess? Yes, come on, emergency, very good. In case of emergency, you can take the consent. Okay, so that is one. Second, in case of therapeutic privilege, in case of therapeutic waiver, or in case of MLC, example autopsy. So when you are doing autopsy, medical legal examination, like example when you are doing say examination of the accused, so in that condition some legal indications also there. So emergency, that is comes under 92 IPC. So remember this, that comes under 92 IPC. So all of you write emergency is equal to 92 IPC. All of you write emergency, that comes under 92 IPC. According to 92 IPC, whatever act done in good faith, so without the consent, that comes under emergency, that is 92 IPC. Yeah. What is section 88 IPC? Anyone can you guess? 88 IPC, that also can be asked. Whenever act done in good faith with the consent, if something goes wrong, it can be grievous hurt or death of the patient, then it is not a punishable offense. So act done in good faith with the consent, 88 IPC. Act done in emergency without the consent, 92 IPC. So both are MCQ that can be asked in the exam. So therapeutic privilege means when the patient condition is very serious, you can divulge the information to the relatives, not to the patient. So because that can lead to anxiety and some other complication to the patient. That is known as therapeutic privilege. Therapeutic waiver means when the consenting right is given to someone, like example son, a daughter, relative, so then it is known as therapeutic waiver. So like example, so all these are the exception for the informed consent. So all of you write 92 is equal to emergency. Next, look at this. So all of you implied consent. I think you can see the patient here. When patient is in the clinic itself or the nursing home, so waiting for you, that implies that consent is given. So that is the implied consent. Next, so therapeutic privilege we discussed. So now some questions about consenting ages for the treatment. So what are the consenting age of the some cases? Medical examination and treatment. What is the consenting age? Anyone can you guess? Anyone can you guess? What is the consenting age for medical examination and treatment? Like example, a patient with the tonsillitis. So you can examine and you can give the treatment, antibiotics. So what is the legal age for giving consent? No, your answer should be equal to 12 years. So all of you correct yourself. It is the 12 years. For medical examination and treatment, 12 years. Second question. Medico-legal examination. Like example, a patient, a patient who is the victim of rape, victim of POXO. What is the consenting age for medico-legal examination? Anyone guess? Yes, again, it is 12 years. 12 years. So it is according to POXO also. So according to rape also, whatever that is rape and all, it comes under 12 years. Now, invasive procedure, diagnostic procedure, general anesthesia, surgical operation and all, it should be 18 years. 18 years. 18 years. Okay, we discussed today. At the age of 18 year, lower end of the radius and lower end of ulna fuses to become single bone. So that we discussed in our classes. So all these are very important. Just revise. Okay. Now question number 5. Patient came with the complaints of hair loss. So patient is having hair loss. So patient is having alopecia. Alopecia is there. And also patient is having some behavioral changes. some kind of behavioral changes, behavioral psychiatric changes are there. Okay, and also there is a loss of eyebrow, medarosis, and also there is a Aldrich-Mees line. Aldrich-Mees line. So this is the question asked in the exam. So what is the answer for this? So what is the answer for this question? So I think many students answered arsenic, which is the wrong answer. Wrong answer. Many of the students in exam last year, they thought it is arsenic because Aldrich-Mees line. So, but remember, Aldrich-Mees line, it is a non-specific finding in arsenic poison. So this I'll go with the favor of thallium poison. Thallium poison. Okay, thallium poison is the correct answer. So thallium is an insecticide. Thallium is the ideal homicidal. So it is also known as poisoner's poison. Okay, I'll write here. So it is also known as poisoner's poison. So this can be asked in the exam. Poisoners. So poisoner's poison. King of poison we discussed, arsenic. Very interesting. Poisoner's poison is thallium. So thallium, so you know, it affects the energy metabolism in the body. It causes death of the person. It can be ideal homicidal. So that is the question asked in the exam. So mercury, no. So mercury will presents with the Pink's disease, Danbury tremors, all this. Lead also we discussed already. So I will go with the thallium is the correct answer. Thallium. So Aunt Thalie case, very famous case. Yes. Now look at this is okay. Fine. Question number 6. A dead body is brought for evaluation. A dead body is brought for the evaluation. On post-mortem examination, ligature that was completely encircling neck. The ligature which was there completely encircling the neck and which is horizontal below the level of thyroid cartilage. There was no dribbling of saliva. What is the cause of death? See, this is the classical case of ligature strangulation. Okay, so it is not throttling. Why throttling? Throttling, there will be no ligature mark. So one point clear. Throttling, this is throttling, all of you. Throttling. In throttling, you will see the sixpenny bruises. There is no ligature mark in case of throttling. So the question asks sixpenny bruises. Small round bruises around the neck. They are known as sixpenny bruises. They are seen in case of throttling. So here it is not, sixpenny bruise is not given. Ligature strangulation is the correct answer. Why ligature strangulation? Because horizontal ligature mark. It is below the level of thyroid cartilage and there is a presence of no dribbling of saliva. Dribbling of saliva is not there. Dribbling of saliva is a feature of ante-mortem hanging. So I will go with the ligature strangulation. What is gagging? So gagging, is the type of suffocation by placing some towel or cloth inside the mouth so that occludes the air passages. Hanging, not the answer. Your answer should be throttling. So answer should be ligature strangulation. So ligature strangulation, so it's one of the very, very commonly asked in the exam. Let me discuss some important features of ligature strangulation. It is also known as classical strangulation. Ligature mark features. So how ligature mark looks. So all of you concentrate. So this hanging, ligature strangulation, throttling, drowning, they are all pure forensic medicine topic. Nowadays they are asking more question from asphyxia. So whenever you are free, just revise asphyxia, drowning in detail. So that can be asked in upcoming NEET PG exam. So ligature mark, how it looks? Ligature mark is horizontal. It is horizontal. Okay, it is not horizontal. Below the level of thyroid cartilage, no dribbling of saliva. You will see bruises, abrasion around the ligature mark. So that is the feature of, you can see here. So this is the horizontal ligature mark. You can see the struggling injuries. You can see the struggling mark here. Okay, struggling injuries are there. Struggling injuries are there. Okay, that can be asked in the exam. Face. Because of the venous congestion, there can be bleeding from the nose and the ear. aberration, ecchymosis, they are very, very commonly present. Very commonly present in case of ligature strangulation. Lungs, because of the breathing efforts, lungs are emphysematous. You can see the emphysematous bullae over the surface. Hyoid bone also very commonly asked. Remember, hyoid bone fracture in hanging, hyoid bone fracture in ligature strangulation is outward fracture. In case of throttling, that is inward fracture. Remember, inward fracture is seen in case of manual strangulation. Outward fracture is seen in case of ligature strangulation, also in case of hanging. Thyroid cartilage, there can be fracture. Subcutaneous tissue that shows soft reddish hemorrhages are very common around the neck. When you open the cut section at the midline, you will see a lot of hemorrhages. You will see a lot of hemorrhages in case of ligature strangulation. CPC, we discussed in our classes, cyanosis, petechial hemorrhages, and the congestion that is more evident. And lastly, cause of death is asphyxia. Asphyxia is the cause of death in case of ligature strangulation. Okay, yes. Now let me ask you one question. Anybody in the class, can you name one condition hanging without ligature mark? Anyone? Hanging without ligature mark. Anyone, can you guess? Hanging without ligature mark. Hanging without ligature mark. Yes. Come on. Yes, hanging without ligature mark. Very interesting question, all of you. So, hanging, there is a case of hanging. So, well-known case of hanging. But during autopsy examination, what I found, no ligature mark. There is no ligature mark at all. So, what it is then? What is the condition in which hanging without ligature mark is seen? Yes. Come on. Yes. Neha Shanai. Beta, Neha Shanai. Very good answer. Neha Shanai, beta. It is a very good answer. Whenever some soft material, like example, some towel, some hair, long beard, when that will come between the ligature and the person, so and there can be no ligature mark. Okay, so that is the answer for that. Whenever there is some soft material, like in case of autoerotic hanging, known as sexual hanging, so in that case it can be without ligature mark. Okay, so that is an interesting question asked you. Good. Next question number 7. A surgeon, this is a very easy question, all of you. So it looks like a story of Arjun Reddy or some movie. So what is actually doing here? Assisting staff notice surgeon's hand shaking and instruments is falling. Eventually nicks an artery. Patient collapses. So what it is, all of you? What it is? Anybody? What it is known as? Anyone? Can you guess? Already we discussed. This is 304 AIPC. Criminal negligence. Consent is not a good defense. Contributory negligence is not a good defense. 2-year imprisonment handled by the criminal court. Res ipsa loquitur. Novus actus interveniens. Vicarious liability. All this you must know in detail. Okay, yes. So yes, this is the answer for this question. It is not civil negligence. It is not therapeutic misadventure also. Dichotomy means fee splitting. Giving commission, taking commission is known as the dichotomy. That is not the answer. So answer will be A is the correct answer. Good. Question number 8. During the court proceedings, see what I discussed, already we discussed courtroom procedure in 2021. Now same question asked in 2022 also. That's why I'm telling you, prepare some high-yielding topics and revise. So there are a lot of tendency to ask the same question or the same topic, not the same question actually. The same topic can be asked in the exam. So forensic around 15 questions, very easy and very scoring subject, and don't neglect. So keep one day, a half day, revise entire forensic medicine, revise notes and go to exam. Okay, yes. So what is the answer for this question? Leading questions are not allowed in all the following except. except is there, and also not allowed is given. That means it is allowed. That is, inference is allowed. So this is little tricky question. So your answer should be cross-examination. And cross-examination is the correct answer. Type of hymen given in the image. Type of hymen given in the image. Come on, yes, what is the answer for this question? You can see the two openings here. Two openings. Two openings are there. So it must be septate hymen. Similar, no, no, no. Next. Next. A 2-year-old child came with a history of ingestion of some iron tablets. So patient came with a history of some iron tablets, presented with a history of abdominal pain, vomiting, cyanosis, hyperventilation. On examination, patient is in comatose condition. So this go in favor of some iron poison, acute iron poison. So you know, all of you, acute iron poison, so that can present with the lactic acidosis. There can be metabolic acidosis in iron poison. So it is a case of iron poison. In iron poison, we normally give, desferoxamine is the correct answer. Ball, no. Penicillamine, no. Activated charcoal, no. Answer is the desferoxamine. Remember, iron poison, there are 4 stages. So iron poisoning, there can be 4 stages. Stage 1, stage 2, stage 3 and stage 4. Stage 1 will present with a history of GIT symptoms. So there will be nausea, vomiting, diarrhea, all these GIT symptoms. Stage 2, symptom free. Stage 3, there will be hepatic necrosis. And stage 4, there will be stricture formation. So there can be stricture formation. So there can be pyloric stenosis. So all this can be seen in stage 4. So it's all given in case and Reddy. There are 4 stages we discussed. The treatment is desferoxamine is the correct answer. Okay, yes. And remember, ball is contraindicated. Ball is contraindicated in anybody? What are the 2 contraindications of ball? Anyone can you guess? What are the 2 contraindications of ball? Yes, come on. Anyone in the class? Can you explain? Yes. Contraindication of ball? Yes, Neelam, but arsenic, no, beta. Contraindication. So Priyanka, question is contraindication. Matlab ball is not given. Arsenic, no. Yes, the 2 indication I remember: cadmium poison and iron poison. And also in case of peanut allergy. So peanut allergy also it is contraindicated. Okay. So remember cadmium and iron. So not copper, it is the cadmium. So that is about the question number 10. Okay. So some VBQs we'll discuss. Some next 10-15 minutes we'll discuss about the VBQs, visual based question. So all of you ready for the VBQs? Ready all of you? VBQs, some VBQs ready? Yes, come on, Priyanka, okay, Karthik, Anis, Neha, Shanai, yes, beta, VBQ, shall we discuss VBQ? All ready, all set? So my dear student, how is the Josh? Yes, come on, beta, come on. So we are sprinting, we are towards the NEET PG exam. So we must learn some VBQs also. VBQs are something, something very, very difficult for the exam, difficult for the students. Yes, come on, beta, come on. Yes, ready, all of you, all set. Next 20 minutes VBQ. Okay, yes, RPR, yes, hi, everyone is telling hi. I'm also in very good mood today. So good mood to teach in PW Sprint. Something, very good initiative we started in YouTube session. So I hope you all enjoying it. Sandeep, Bhavana, yes, recent FMGE question. We'll discuss some other day. FMGE will keep some other sprint beta. Yes. So now we'll discuss some poisonous seeds, poisonous plants, poisonous salt, and poisonous snakes. So rest all we'll discuss in some other session. Now I'll keep it simple. Seeds, plants, salt, snakes. Snakes. Ready? Fine. Okay. Now ready? Ready all of you? Look at this. Look at this. This is a picture of a plant. What is this plant? All of you just identify. So I'll help you some tricks. Ready? Yes. So this is the very simple. All of you actually, let's see now how many are going to answering. Yes, yeah, this is one. Okay, I'll write this is one. This is the first one. Let's see who is going to answer. Yes, we can see the spiny projections. So this is the very good answer, Datura. So this is Datura poison. Okay, this is Datura flower. This is Datura seeds. So Datura seeds. So it is also known as thorn apple we discussed. It is confused with the capsicum seeds. It is double-edged, kidney shaped, fatal dosage is 100 seeds, 75 to 100. It is used as a road poison. It is also used in robbery, road poison and all we discussed. What is the active principle? Anyone can guess? What is the active principle? Active principle. So hyoscine, hyoscyamine, atropine we discussed. Treatment, physostigmine. So all in one go we should know. Physostigmine is the treatment, hyoscine, hyoscyamine, atropine the traces, 9D manifestation, carpologia, muttering delirium, all this question can be asked. So this is the Datura. You can somewhere you write Datura is very important and you should know very well in detail. Okay, that is about the first one. Second, let's see now who is going to answer. Second, let's see. So this is the one, this is the second one, and this is the third one. Now let's see who is going to answer this. Yes, come on, 2 and 3, come on. Shiny seeds are there, and you can see here this is the spiny projections are there. Whenever question given in exam, so all they are in clusters. So Datura is single. Datura fruit occurs in single, but here all they are in the clusters. So what is this? So this is castor. Okay, so this is castor. So this is the castor plant and the castor seeds. So already we discussed, it contains resin, it inhibits protein synthesis. Umbrella murder case, it is one of the homicidal agent. It can be agent of bioterrorism. So fatal dose is 10 seeds, it inhibits protein synthesis. And this is dull seeds are there. Okay, 3 dull seeds are there. What is this 3? Very good, healthy pill, correct answer. This is the Crotantiglium. Very good, Crotantiglium, very good answer. Next, look at this very nice picture. So this is a fourth picture. Come on, come on. So what is this? 4. Yes, come on, try. You can see some the round central depression. So what is this? Poisonous plant which causes convulsions. It inhibits glycine in the spinal cord. It causes contraction, opisthotonus, pleurosthotonus, rhizus sardonicus, convulsions, look like tetanus. Very good. So this is the Nux swamica. And this is strychnine seeds. Strychnine seeds are there in this. Strychnine seeds, it contains brucin also, loganin also. So that also can be asked in the exam. So what Nux swamica contain? BSNL. Remember, BSNL is a mnemonic. So B for brucin, S for strychnine, N for Naxomica, L for Loganin. Loganin. So all of you write. So Naxomica is equal to BSNL in the chat box. So all of you write. So all of you write. So Naxomica is equal to BSNL in the chat box. Right? BSNL. BSNL in the chat box. BSNL. So active principle is BSNL. Fatal dosage 1C. It resembles like tetanus. So it is the postsynaptic inhibition of the glycine in the spinal cord. It is not presynaptic, it is a postsynaptic. Okay, yeah. Naxomica is equal to BSNL. Yeah. This is bitter in taste. That's why it causes emesis. Naxomica, it causes vomiting, vomiting because of the bitter in taste. It is not an ideal suicidal agent, not an ideal homicidal agent. It is usually accidental poison. So it is also known as a dog button. That also can be asked. Dog button. It is used to kill street dogs. That's why it is known as dog button. Okay, dog button. So next, look at this. So this is the fourth one. Now this is the fifth one. Fifth one and sixth one. Come on, beta. Come on. Yes. Loganin, beta. Loganin it is. Loganin. Alpha loganin. Niacinamide. L for Loganin. So this is Raticetes abrus. So this is marking nut. So marking nut we discussed already. I won't discuss much about this. Then 7 and 8. 7 and 8. 7 and 8. You can see the white flower. You can see the white flower. And you can see the pink flower. Pink flower. What is this? What is this? 7 and 8. Can anyone guess? Anyone? Come on, guess. Come on, guess. What is this flower? 8 1. Come on, beta. Come on. Yes. Very good. It is the Calotropis. Calotropis procera. So it is the procera. And this is the gigantea. What is the medico-legal importance? Used in abortion, infanticide, feticide. Okay, Calotropis. Artificial bruise also. Then 9 and 10. 9 and 10. Let's see who is going to answer. 9 and 10. 9 and 10. Yes, come on. 9 and 10. Yes. Very nice pictures. Beautiful pictures. So, yes. So, this is Papaver somniferum. Okay. Papaver somniferum. So, these are all poppy seeds. Okay. Poppy seeds. Poppy seeds are non-poisonous. Remember, poppy seeds are non-poisonous. So they are used in laddus. They are used in laddus. They are used in some preparation, some sweets and all laddus. So 9 and 10 went very well. Very good, beta. Healthy pill, Nelam Bhatia, Anil, Tarakanta Das, beta. Very good. All are answering. That is great. Shifana. Next. Now look at this. 11. What is this? 11, 12, 13, 14 and 15. Yes, let's see who is going to answer. Yes. Come on. Yes. So this is to definitely very simple bang. I think many answered bang. Bang is the preparation from the cannabis sativa. It contains up to 10 to 15% of the 9-tetrahydrocannabinol. Okay, bang it is. So this is ganja. Around 15 to 25. It is used for smoking purpose. Again, cannabis sativa, 9-tetrahydrocannabinol. This is charas. Around 30 to 40% of the active principle. Charas. Anyone, can you guess what is this? Anyone, can you guess what it is? Yes, come on, what it is? It's what it is. Anyone can you guess? 12. 12, what is that? 12. 12, what is this? 12. Laddu. I know laddu, okay, fine. So what is that? Sweet prepared from cannabis. Mazoon. So mazoon is the correct answer. Mazoon. And this is hashish oil. So this is hashish oil. So one of the most poisonous is the hashish oil. So hashish oil is the most poisonous among the 5. So there are 5 preparations: bhang, mazoon, charas, ganja, hashish oil. And remember, those who are taking cannabis for a long time, they develop impulse to murder, impulse to kill. What is that known as? Anyone can you guess? What is that known as? So those who are taking cannabis, say example, so some people they take cannabis every day, so almost years, 1 year, 2 year. So they have developed some impulse disorder. So impulse of killing people, so killing friends, strangers, then others and all. So what is that known as? It is an impulse disorder that is known as run amok. Okay, so run amok is also question asked in the exam. So run amok. So run amok is an impulse disorder that can be asked in the exam. Very good, very good. It causes amotivational syndrome, run amok, and it causes some degree of dependence, not very high degree, some degree of dependence in the usually psychological dependence, less physical dependence. Now look at this plant. What is this plant? This is a very nice plant for me. It looks like very nice, very attractive is there. When I look at this plant, I remember Diego Maradona. So I am giving you a clue. I am giving you clue here. So that is Diego Maradona. So what is this plant known as? So what is this plant known as? This is cocaine plant or coca plant. So this is the coca plant. The derivative is cocaine. Cocaine is very commonly asked. I know. So this is the question number 16. Question number 16 image 16. Next. Look at this. Very nice cherry. 17. Very nice cherry is there here. Poisonous cherry. So whenever this poisonous cherry is a question asked. So this must be Atropa belladonna plant. Okay. Atropa belladonna. Atropa belladonna plant. So this is Atropa belladonna plant. Fine. Yeah. Then 18. Some cardiac poisons. We'll discuss about some cardiac poison. Look at this. So what is this? 18. Whenever some root is given exam. So whenever some root is given, salivation given, hippus is given, some poisonous cardiac poison is given, arrhythmia is given, bradyarrhythmia is given, heart block is given, it must be aconite. Okay, this must be aconite root. Aconite root. Yes, aconite root. Aconite is a cardiac poison. It causes hippus. So it is confused with the horseradish root. 19. Whenever you see yellow flower, some cardiac poison, yellow flower, yellow oleander. And can anyone guess what is the scientific name of yellow oleander? What is the scientific name of yellow oleander? Anyone can you guess? So this is known as Cerbera tibeacea. Cerbera tibeacea. Cerbera tibeacea. Okay. So Tibetan is the active principle. This is 20th one. We can see the poisonous mango. So poisonous mango, which is also known as suicidal mango, suicidal green mango. Suicidal green mango, remember it is known as Cerbera odolum. So it is known as Cerbera odolum. Cerbera odolum. It is known as suicidal mango. It is used by some people so to commit suicide. Cerbera odolum. Then this is the foxglove. 21. Foxglove, that is nothing but the plant of the digitalis that can be asked in the exam. Foxglove, pink color, foxglove type of flowers, digitalis plant that is, and this is actually the plant of the tobacco plant. Okay, tobacco plant. So tobacco, nicotine is also cardiac poison. So that can be asked. And one more here, that is one more oleander known as pink oleander. One more known as pink oleander. So the pink oleander is known as Nereum odorum. Nereum odorum. Remember, Cerebera thievetia, yellow oleander. Nereum odorum, that is the pink oleander. So remember, Cerebera thievetia, Nereum odorum, that is cardiac poison. Okay. So this is about some brief about the cardiac poison. Yes. Okay. Next. Now here look at this. What is this? What is this? Question number 22, 22, 23, 24, 25 and 26. Anyone can you guess what is 22? Come on, come on, come on, love it. Try. Blue in color, metallic poison. Metallic poison, blue in color. Blue in color, metallic poison. What is 22? 22, come on. Copper sulfate. It must be copper sulfate. Copper sulfate. Copper sulfate. Yes. Then this is arsenic trioxide. This is arsenic trioxide. We discussed, or thallium also. So thallium also looks same. So arsenic and thallium looks same, white. So green color. Anyone, what is this green color? So mixture of, copper and arsenic. Anyone, can you guess? Anyone? 23? 23 ho gaya, 24 beta. 24 beta. So mixture of copper and arsenic, Scheele's green, Paris green. So this is Scheele's green. So Scheele's green, Paris green, all these actually, they are actually arsenic and copper containing insecticides. So they are coloring agents also. Now 25. So 25, 25, look, a red color compound. What is a metallic salt which has a red color compound? So that is, what is this? So this should be mercury sulfide. Okay. So this should be mercury sulfide. So mercury compound should be mercurous sulfide. And this is elemental mercury. Elemental mercury. So all these images, so this can be asked, any one of the image can be asked in the exam. Next, this is a beautiful question. One of the nice question, very interesting question. So question number 27. So what is this? 27 and 28. Toxicology. We're discussing toxicology only, but forensic medicine images we'll discuss some other day. So what is this 27? Anyone, can you guess what is this 27? 27. Come on, 27 is a phossy jaw. So it is phossy jaw. So occurs in case of phosphorus poison. It can be white phosphorus or yellow phosphorus poison. So phossy jaw, remember, and in case of phosphorus poison, there can be hepatic necrosis also, that can be asked. So this is red phosphorus. Red phosphorus is non-poisonous. Red phosphorus is non-poisonous, only the white phosphorus is the poisonous agent. Remember, smoking stool syndrome. Okay. Brown postmortem hypostasis. So all this that is seen in case of phosphorus poison. Okay. So that is about the 27 and 28 phossy jaw. Then some snakes. We are going to discuss now snakes, into the very important topic, snakes. Look at this. What is a snake? 29. This is 29. So you can see here there is a hood is there. There is a hood, and there is a hood is there. Spectacle mark is there. So hood, spectacle mark, and all. So what is the answer? So this is actually naza. Okay, naza. Remember, it is neurotoxic. So what is the earliest sign of naja bite? Anyone, can you guess? What is the earliest sign of naja bite? What is the earliest finding? Earliest finding will be ptosis. So there will be ptosis, so difficulty in breathing, respiratory paralysis and death. So patient is unable to lift his head, so from the clinical bed, that is known as broken neck sign. So the broken neck sign is a feature of nasa, that is a neurotoxic snake. It acts on the neuromuscular junction, it causes respiratory paralysis and death. Next, look at this. This is, second type of snake. You can see the, dark color spots. You can see the dark, three rows of dark brown or black color spots are there. So this must be hemotoxic snake, that is known as Russell's viper. So Russell's viper. So it is Russell's viper, and remember all vipers are hemotoxic. So that causes DIC, disseminated intravascular coagulation, increased clotting time, increased bleeding time, vesicles, bleeding, extravasation of blood, hemorrhages and death. That is Russell's viper. All vipers are hemotoxic. Then this is the one more viper, that is known as saw-scaled viper. Saw-scaled viper. Saw-scaled viper. So remember, saw-scaled viper, it is also hemotoxic. It causes same clinical features like Russell's viper. So what is the finding here? You will see the white wavy line. You can see the white wavy line. This is known as saw-scaled viper. Then, so this is the common crate. So common crate is also very commonly asked in the exam. So common crate, you will see the transverse white band. You will see transverse white band. So along the surface of the snake, you will see the transverse white band. And remember, common crate bite is painless. Common crate bite is painless. It has a tendency to bite people even without stimulus. So that's why in one of the NEET PG exam question asked, following snake bite resemble like stroke. The following snake bite resemble a stroke. Your answer should be, that is your common crate. So common crate. So this is about the 4 important snakes. Remember, all vipers are hemotoxic. All neurotoxic snakes, especially common cobra and common crate, they cause respiratory paralysis and death. And the most toxic among the all snake is the common crate. So the fatal dosage is 6 mg, which resemble like stroke. The treatment of all the 4 snakes is polyvalent antivenom. So polyvalent antivenom is given. Remember, polyvalent antivenom, there is no test dose is given. The dose is similar in children as well as in case of adults. So the one of the common side effect is the anaphylaxis. It is of horse origin, equine origin, leads to anaphylaxis. So all this about the snakes and all, the question can be asked in the exam. So yes, now interesting question. Now a bit difficult, all of you. Look at this. So what is this? I think 29, 29 and 30 and 31. 31. Can I identify this? So this is asked in one of the NEET PG. Yes, come on. Yes, 29. 29, you can see here the third scale. You can see the 29 and 30. Third labial touches the both eye and nostril. So third labial scale, that is supralabial scale, that touches the both eye and nostril. So what is this snake? Anyone, can you guess? Anyone? Very good. So this is common cobra. Common cobra. So it is asked in one of the exam. So in common cobra, third supralabial touches the both eye and nostril. So that is a very important finding. And whenever fourth labial is largest fourth labial, your answer should be common crate. So common crate. Yes. So this is about the question number 30 and 29. Okay. So once again, I repeat. Third labial fold touches the both and eye and nostril, common cobra. Fourth infralabial largest, common crate. Yes. Now look at this. I think now you can answer sprint question. Now you can answer sprint question. Now all of you try this. Patient presented with history of snake bite, ptosis, paralysis, external ophthalmoplegia, unable to speak, unable to raise his head, 2 hours after bite. What is the most probable diagnosis? What is the answer for this question? Anyone, can you try? So this is definitely D is the answer. D is the answer. This is the classical presentation of common cobra. Classical presentation of common cobra. So neurotoxic symptoms are very common. Okay. Yes. So this is common cobra. Correct. Look at this question. A girl age 10, otherwise healthy, sleeping on floor, suddenly develops nausea, vomiting, abdominal pain, quadriplegia at night. There is no swelling or burning pain. So this is the clue here. Burning pain is not there. No swelling is there. But signs of intoxication, they are intense, and albumin present in the urine. So whenever this type of question is framed, so remember, no swelling, no pain, nothing. Your answer should be great bite. So it resembles like stroke. Okay. So this is a very, very important question, sprint question. So PW sprint. So these are all some added edges. Then so I think this is the last slide, last but one slide. So yes, now we are having so 32, 33, 34 and 35. So 31, 32 is very simple. Scorpion we discussed today. Scorpion, it causes extreme degree of pain. And 33, remember, Spanish fly. Anybody in the class? What is the active principle of Spanish fly? Anyone, can you guess? What is the active principle of Spanish fly, which leads to priapism, which leads to some symptoms of organic irritation, nausea, vomiting, kidney damage? Anybody in the class? Asked in NEET PG. Some 5 years back this question asked. So Spanish fly, so that is, what is the active principle is the question asked. Anybody? Cantharidin. Your answer should be cantharidin. So cantharidin. Active principle is cantharidin. 34 is the poisonous lizard, which is known as Gila monster. And 35 is the python. So python, and what is the cause of death in python? Your answer should be traumatic asphyxia. All this is some rare question asked in some of the exams. So yes, cantharidin is a very good question asked in the exam. Now last question for you. Last but not the least. Okay. So we are ending the class. We are into the last part. Last slide. No, nothing now. Okay, I am showing you some laddu here. Laddu and cyanide Mallika, and also a picture of web series Abhay 2. I think you got the poison which I am going to discuss now. Yes, come on, beta. Asad Ahmad, beta, come on. Priyanka, Anis. Okay, so yes, come on. Thank you, Asad. So I am giving you laddu. I think you are all happy, and also I am discussing some cyanide Mallika story. So I think, hope you got the answer. So this is cyanide. So cyanide Mallika, very famous case. So she killed more than 10 people by mixing cyanide with the laddu. So it is actually cyanide Mallika case. Okay. And also whenever some who are watching this Abhay 2 series, you must be aware of that. So the question is, cyanide, all of you, what is the treatment of cyanide? Nowadays cyanide, they're asking too many questions from cyanide. So cyanide, remember, it produces bitter almond smell. So I'll write here, it produces bitter almond smell. So this can be asked in the exam. Bitter almond smell. It affects the complex 4. It causes histotoxic hypoxia. hypoxia. Okay, this is asked in recent exam. So it causes histotopic hypoxia and death. Complex 4 electron transport chain. Treatment is also very commonly asked. Anyone? What are 3 drugs used in cyanide poison? Anyone, can you guess? What are 3 drugs? Yes, 3 drugs used in cyanide poison. Yes, your answer should be sodium nitrate, amyl nitrate, sodium thiosulfate. So what are 3 drugs can be used in cyanide? Sodium nitrate, given intravenously, that binds with the cyanide, it forms cyanohemoglobin. So that cyanohemoglobin, that combines with the thiosulfate, it gets excreted in the urine. So sodium nitrate, sodium thiosulfate, both are given IV through the same needle, and amyl nitrate, so that is given inhalationally. Cyanide is one of the ideal suicidal agent. It also can be used in homicide. There can be accidental also. One very famous case is the Bhopal tragedy case. So Bhopal gas tragedy is the one of the accidental cyanide poisoning case. So this is about the cyanide. Okay. So all of you, hope you understood this. So now with this we'll end the class. So we discussed almost I think some 30 to 50 images today. 30 to 50 images and most of the high yielding topics discussed today. And if any doubt you can ask me, anonymous and others, you can ask me. So yes, with this now I'll end my class. You cannot change your future, but you can change your habits. Surely your habits will change your future. So now every day just prepare some notes, some handwritten notes, forensic medicine or any subject. Revise just before the exam. You will definitely get success in upcoming exam. With this, thank you for your patience. Thank you for your patience, Priyanka and others, and wish you all the best. Wish you all the best for upcoming exams. Do well. Thank you. Yes, tell me, healthy PL, what is the doubt? Yes, doubt. Any doubt you can ask me now. Yes, come on, doubt. Yes. 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 So, what is the doubt? Any doubt you can ask me? Yes. Come on. Yeah. PDF will provide you. Don't worry. Yeah. Any doubt? Any doubt you can ask me? Any doubt you can ask me? Yes. In shotgun photos, please explain first and third picture. Okay, shotgun. So we'll discuss about the shotgun. Please explain third and yeah. Beta, what is the doubt? Tell me. What is the doubt? Yes. Come on. Yes, beta. You just look at the picture 2 and picture 3. Pick first and third picture. Explain first picture. Yeah. First picture you can see the cruciate. Cruciate type of entry wound with irregular margins. So that cruciate incision and all. So that go in favor of it is a contact shot. So contact shot, you will see serrated edges. So what happens, when gas enters, so when a shotgun, that gas flame enters to the into the wound, it will come out. So that causes more averted type of wound. Yes, and 3, that is nothing but your serrated margins, that is known as nibbled margin, that looks like a rat hole entry wound. Yes, 1 and 3 looks same. So but whenever in exam question asked rat hole entry wound, your answer should be near shot, close shot, oval or round, and satellite lesions in case of intermediate range, and distant range you will see only the multiple pellet wounds. Yes. Yes, okay. Yes, with this now I'll stop the class.